qualities. I'd like to call the Monday, August 23rd, 2021 Grafton School District Board of Education meeting to order. Ask all those present to please rise for the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We've got two items on the consent agenda this evening. We've got the approval of the minutes of the July 26th board meeting and a statement of receipts and expenditures for July. We have a motion to approve the items on the consent agenda.
So moved.
Second.
Any discussion? Hearing none, all those in favor of the motion, aye.
Aye.
Opposed, and it passes. Action items, item 4. Jeff, the superintendent's report.
Yes, congratulations to Kennedy Elementary School. They are a winning school from Beanstack's first National Summer Reading Challenge Level Up, sponsored by Thorndike Press and Mark Cuban. Kennedy received an honorable mention prize of $750 for them to be able to utilize. So congratulations to Kennedy and the ability to use that money for some of our students for reading. So great job to them. And then some different dates for the board as a reminder. All staff in service starts tomorrow, August 24th through the 31st. We have elementary Great Start conferences on August 30th and the 31st for our elementary students. JLMS Sneak Peek is this week on August 26th. And then the Grafton High School has their back to school night on September 8th. And we have that staggered start again whereby first day of school is grades 6 and 9th through 12th on Wednesday, September 1st. And then grades EC 4K through 5th, 7 and 8 on Thursday, September 2nd. Parents have gotten emails about this. I would recommend that people download the app. The app is a great way. We have a new website. The app is a great way. Get push notifications. And when you first download the app, you do get push notifications for all the schools, but so you could go into the settings and adjust that, because I was talking to Kara about that, asking why I was getting all those things. So you can go in and adjust it. So just for parents for their own child or their own school, or they want to know what is happening across the district, they can do that as well. But the app is great to get all these reminders. And then we received an email from the Grafton Educational Foundation about some of the things that they have coming up. Port Washington State Bank Color Blast is this Sunday, August 29th at the high school track. There are already more than 320 participants registered. The high school cross-country team will be leading the race. Haley Balt, GHS senior, will sing the national anthem, and the GHS football team will be throwing color at a color station, and the Grafton Booster Club will provide concessions. So if you haven't registered yet, you can still do so online until Wednesday. After that, you can visit Port Washington State Bank from 9 to 5 on Thursday and Friday to register or pick up your race packets. Hope to see everyone there to kick off the school year with color. And their annual appeal, Seeds to Harvest campaign, will launch this year in September with an email component in October to the community and district families. And then Portraits in the Park is scheduled again for September 19th at Lime Kiln Park. Sign up at the GEF site to get a great family photo and support GEF. And then yesterday, the Grafton High School Athletic Booster Club had their 61st annual corn roast. So thank you to all the families that attended that. The Athletic Booster Club and their board did a great job, led by Miss Weir and her team, of promoting it, and then all the work that went into that. They had a great day with the weather. Great to see students, whether it was cheerleaders, football team, kids playing basketball, dancers. There was just a ton of people there throughout the day, and it was great to see people being able to do that and support our athletic program and the work that they're doing with that. And with that, that concludes the superintendent's report.
Thanks, Jeff. Any questions for Jeff? All right, hearing none, then let's move on to public comment. Show of hands, how many people are here this evening to speak during this segment of our meeting? Okay, there are a fair number of people, and I would just ask that we keep our comments. Well, first of all, when you come up, we're going to ask that you come up and use the microphone up here so all those that may be watching at home can hear. But you announce your name and your address, and if you could keep your comments limited to 3 minutes. If there are repetitive information to be shared, and there may or there may not be, I appreciate the board appreciates the fact that you came out this evening to share your opinions or your thoughts. But if there are things that are repetitive and you want to indicate somehow that you support what has been previously said, let us know. If you have new comments, let us know about that as well. I can say that I have received about 37 emails, I believe all of which either you have been copied on directly or I have forwarded directly to you. So roughly 37 comments that I've received since the last meeting of all sorts. So they're part of this public comment. You have them, you understand what each of those are. So again, feel free to come up one at a time, state your name, your address, and we'll proceed.
Hi, my name is Carolyn Wagner. I live at 1505 Wisconsin Avenue in Grafton. My name is Carolyn Wagner. My 2 oldest children will be attending Kennedy this fall in 1st and 3rd grades. I'm here tonight to advocate for their physical and emotional well-being. Regarding COVID precautions, I anticipated that we would see a continuation of the science-driven decision-making that worked so well last year. But only 2 hours after the CDC issued clear and direct guidance that masks should be mandatory in all K-12 buildings, I was more than surprised to find the superintendent's email stating that we would not be doing that. We would be ignoring the guidelines and doing away with the protocols that worked so well last year. At the last meeting, we were told that low community transmission, vaccine availability, and previous low spread of COVID within the schools meant that we did not need the same mitigation techniques as before. However, community transmission is now high, the vaccine is still not yet available to those under 12, and the limited spread within schools last year was likely due to the measures that were in place. We can't remove all of those measures and assume that we'll get the same outcome, especially with the rampant spread of the Delta variant. While I understand that there wasn't spread in the summer school classrooms, case rates at that time were extremely low, and we simply don't live in that world anymore. As a licensed clinical professional counselor and psychotherapist, the mental health implications of this are very worrisome to me. What will the impact be of school closures? What will the impact be if they bring COVID home to their family? A friend of mine in the suburbs of Atlanta has a 1st grader. On the 3rd day of attendance, she contracted COVID at school and brought it home. She's racked with guilt because she spread COVID to her family and is afraid to return to school for fear that it could happen again. This will haunt her for quite some time. Imagine what the impact on a child would be if a family member did not survive an infection that was brought home from school. While I'm heartened to see the recently proposed data-driven checkpoints regarding the return of mitigation, it's not enough. My suggestion is that we begin the school year with masks for 14 days. As the district acknowledges, this is approximately the length of time it would take for COVID to incubate within our schools. This is key because if we've underestimated the amount of virus circulating in our student body, the results of starting without masks could be disastrous. Borrowing from the proposed checkpoint system after that 14-day period, assuming we can stay below the 10% cutoff, masks could become optional in middle and high schools, where nearly all students are eligible for vaccination. In the elementary schools, where nearly none of the students are eligible, we should continue to require masks for 5 weeks following the authorization of a vaccine, the amount of time it would take to be fully vaccinated. Personally, I'd prefer that we mandate masks in all school buildings until the CDC and American Academy of Pediatrics say they're no longer needed, but I'm trying to find middle ground here. All our kids deserve to be in the classroom safely. Please don't forget about our students under 12 who haven't been given the opportunity to be protected from severe outcomes like our older students have. It's every student, every day, right? Let's get across this finish line together. We're talking about weeks here, not years. Thank you for listening.
My name is Cindy Malloy. I live at 1216 Iris Lane in Grafton. My concern is a lack of a mask mandate in the elementary, middle, and high schools for people, students, and staff. While some of this population have a choice to vaccinate or keep their kids at home, some don't. To protect our most vulnerable, we need to think altruistically. Our kids can get sick. These kids may be carriers that share their virus with their elderly grandparents, immunocompromised family, and those unable to get the vaccine. Does our district not care about our community? Are you ready to gamble the health of the Grafton School District? According to the New York Times, cases have increased recently and are very high. The number of hospitalized COVID patients has also risen in Ozaukee County area. Deaths have remained about the same level. The test positivity rate in Ozaukee County is high, suggesting that cases may be undercounted. We have become numb. We hear about cases, variants, and complications and feel like it's a fantasy world. I work in healthcare and I see the tragedy. I've had numerous family members affected, some still feeling the long-term effects. What is the harm in requiring masks for the first half of the school year and reevaluating as time goes on? When the community burden is substantial or high, face coverings should be required. Was this provision even considered? Some schools are making face coverings mandatory, while the community burden is even moderate. In Aurora, the company I work for, COVID patients have quadrupled in the past months. Approximately 30 days ago, mid-July, there were 20 to 30 inpatients. Now there are over 240 COVID inpatients as of August 11th. Due to the surge of COVID-19 in our communities, the pre-procedural testing guidance has been modified at my company. Based on CDC guidelines, earlier this year, AAH allowed vaccinated patients to forgo testing prior to aerosol-generating procedures. Given the increase in COVID-19 cases, AAH, Advanced Aurora Healthcare, now requires pre-procedural testing regardless of aerosol-generating procedures, regardless of vaccination status. In the document regarding school operations for the 2021 school year, the board admits to risk in Ozaukee County is on high, page 3. Despite the Washington Ozaukee Health Department guidelines recommendation that the mitigation strategy of consistent and correct use of masks. Page 6, the guidelines state and address the percentage of fully vaccinated. Does this take into account the kids that are in 4K through 5th grade? No. Is there a page dedicated to the Wisconsin Department of Health guidelines? No. To the CDC recommendations? No. Or how about the American Academy of Pediatrics? No. Curious as to why these well-known institutions were not quoted in those guidelines. Page 7 also states that there's low community spread in Ozaukee County. Then why is the Ozaukee County burden high when you claim there's low community spread? Furthermore, on page 23, it states that a shift in operations would occur at 5, 10, and 20% positivity rate in the classroom. Unbelievable. What if the U.S. positivity rate hit a 5%, 10%, or 20%? The public would be outraged. Let's break down the numbers. As of today, there is a 14% increase in the U.S. moving average. That means numbers are rising. Furthermore, if one child out of a 24-student classroom is positive, that's a 4% positivity rate. Page 22 states that there will be a measure put into place at 5%. So one more child needs to be sick, right, in that classroom to have a safety measure put in place? What kind of Band-Aid situation is this? Why are we reactive instead of proactive? Given the rapid spread of highly contagious variants, an increase in cases and hospitalizations, and the impending flu season, we should be compelled to act now. There are too many flaws. There's too many holes. Why can't we be an altruistic school district that cares for our weakest? This not only includes the young and the immunocompromised, but their grandparents. On July 27, 2021, the Center for Disease Control and Prevention issued new guidance that vaccinated people should wear a mask indoors in public if they're in an area with substantial or high transmission, and that universal indoor masking for all teachers, staff, and students and visitors to K-12 schools, regardless of vaccination status, should be implemented for the 2021 school year. On July 28th, 2021, the AAP has already issued a universal school masking recommendation. Face masks can be safely worn by all children 2 years of age and older. According to the Wisconsin Department of Health Services, there are some settings where everyone, even if the fully vaccinated, should continue to wear masks. Healthcare settings and K through 12 schools. In addition, they state that, quote, "You don't need to wear a mask inside your home or your household members," end quote, or outdoors where it's possible to maintain 6 feet of distance from others. For outdoor activities that are independent or only with members in your household, masks are not needed. There will be no social distancing this school year, no cohorting, and no outdoor classes. According to the news graphic dated 8/18/21, 12 local physicians wrote to the editor imploring, quote, "Please send your children to school in a mask this fall. COVID cases and hospitalizations are increasing for all ages, including among the pediatric population," end quote. These are the physicians that we trust enough to care for our kids. Why can't we listen to our physicians and they make that simple recommendation? Why does the school board not take professional recommendations of the CDC, the American Academy of Pediatrics, and the Department of Health Services, and the requests of 12 community physicians? The science is there. Can you tell me which one of you have a degree in infectious disease and public health? Because I'd like to know what qualifies you to make that decision for my child.
Hello, my name is Kyle Stevens. I live at 1282 Trailway Drive. I have a 7-year-old and second grader going into Woodview Elementary this year. I also agree and concur with the comments shared previously by our community members. In addition, I thought it would be helpful to back their comments up with data that you can use to justify to change the optional masking policy. On July 26th, this board voted to institute the optional masking policy for summer school. And there was a stipulation that abrupt or sustained increases in the community may result in modifications to this policy. Unfortunately, as others have shared, we have hit that tipping point already. As of today, we are at levels that were previously seen in January 2021, unfortunately. And I believe this constitutes a very abrupt and dramatic shift in case increases in Ozaukee County. On the back page here, you will see a timeline of all recent events leading up to this date, including today. On the July 27th is when CDC officially released these guidelines for indoors mask recommendations. On August 9th, the CNN then released an article from AAP and CDC stating that all children over 2 should be masked indoors. Quote, "Our children deserve to have full-time, in-person safe learning, and that includes masking for everyone in schools," CDC Director Rochelle Walensky. On August 18th, here in the local Wisconsin community, hospitalizations from COVID-19 in southeastern Wisconsin have increased more than tenfold, and the surge of infections across Wisconsin. That's Wisconsin Public Radio. And unfortunately, yesterday, an article came out by the Wall Street Journal. Department of Health and Human Services show pediatric hospitalizations for COVID-19 at the highest point since the agency began tracking them last year. Children's hospitals are bracing for even more cases as schools reopen. Last year, I felt that this school district and school board did a fantastic job of keeping everyone safe to remain open, and I ask that you reinstitute the indoor masking policy. Thank you.
Hi, my name is Kristen Gasser. I live at 1903 South Green Bay Road. I have a daughter who's entering high school, and I've had 2 kids go all the way through kindergarten in Grafton School District. And I just want to start off by saying that when I heard about the policy in July that was approved for this year, I was so shocked. After last summer, I went into the school year talking to parents that I knew from other communities, other states, other places, even communities around here. Everybody was looking to Grafton for their guidance. You guys aced it last year. You did such a good job. same people sitting here, right? And I just couldn't figure out what was going on. So I decided just to look up, like, okay, what was happening exactly this time last year versus this year? And so I looked up some historical numbers, and I won't share the exact ones, but basically last year, on the 31st of August, in Ozaki County, new cases by day, 12. So 12 cases per day. This year, 35. Last year, Ozaki County active cases on the 31st of August, 186. This year, 646. This was 3 days ago, 820. Transmission level last year was 68 people per 100,000. This year, just a couple days ago, 147 per 100,000. In other words, it's so much worse than last year. And it's so puzzling to me how last year's recommendations, masks on buses, this was before the state mandate. This is what got approved. Masks on buses, masks during arrival and dismissal, masks when you can't be 6 feet apart, hallways, restrooms, cafeteria, masks when people were symptomatic. In high school, going all the way up, whenever you couldn't be 6 feet apart, a crowded classroom, small groups, talking closely. And same with staff. If you couldn't be 6 feet away from someone, you needed to have a mask on everywhere you went. I just can't fathom what we did between last year and this year to decide to disregard this evidence that is so key. Yeah, we have vaccinations, awesome. It's not helping in every case, and we have 2 entire buildings chock full of children who cannot get vaccinated, period. I don't have children in those buildings anymore, but it breaks my heart to think about those kids and their parents and grandparents and people in their families who might have illnesses that they could die from if they got COVID from these little kids. And not to mention the kids themselves, obviously, that's a given. So I don't understand how we can lower safety standards with the evidence that's so much worse than it was. I can't understand how we can go against CDC guidelines when that was a driving force to our decision-making last year. And how can we just basically subject an entire population of unvaccinated children to this humongous risk? It's just inconceivable. Last year, we were stay safe to stay open, and we did. You did it. It worked. That's all I keep thinking is, oh my God, you did it, and it worked. Everything you did last year worked. That's why we had an awesome year. I feel like this year, the motto should be, so what? Stay open. I mean, come on. This is painful. It's very, very hard to believe that we're lowering our standards so much in this school district.
We're going to do posters, we ran out of time. Just have to do our best.
Hi, everybody. I'm Casey Didier. I live at 1063 13th Avenue. I'm here tonight with I've prepared this speech. I'm going to call it Hope is Not a Strategy. Maybe you've heard that term before. As we go into the new school year, I'm here to point out that I am struggling to see how we are living up to our motto of every student, every day. As a board, I have admired your ability to look beyond politics and support what is best for our students. I realize we are at a crossroads in our history, and as things are changing and even crumbling around us, I am proud to live in this community where we talk about our differences and even listen to each other. Throughout last year, our district took precautions that were required to keep everyone safe, and not simply recommended. Unfortunately, for those of us who have taken the vaccine and willingly participated in following the rules over the last year, it's hard to see how we are in it together, as I think many of us hope to be. As a board, we the voters task you with looking to the experts when making the right decisions for our district that are beyond your expertise. I know for those eligible, we are close to the 70% vaccinated in Grafton. However, this does not include anyone under the age of 12. I fail to understand how we can move into the school year without any protections in place other than surface cleaning and air ventilation for our youngest learners when every health data source is pointing to indoor mask wearing as the best possible protection at the lowest possible cost. Is our plan to wait until we have a few third graders in the hospital? Is our plan to hope that doesn't happen? I seem to remember one of our wiser board members saying at some point that hope is not a strategy. So why is this our strategy now? I have included some visuals to share community burden and how much it has changed in the last month. That's page 1 through 3. That's countrywide, but it's visual. So please consider this when pointing to summer school as an example of low transmission. As you can see, the burden has changed significantly. Given the red status provided to us by the CDC and the Wisconsin Department of Health, which is also page 5, that's the Wisconsin one, I would implore this board and the administration to defer to the experts when considering mask requirements. If local instructions are what you're looking for, I would encourage you to take in the letter to the editor from the news graphic on August 19th, provided by 12 local pediatricians, many of whom serve our own children, including mine. That is on page 6. These trusted doctors also wonder why we wouldn't err on the side of caution as we navigate this time of higher transmission in our community. That being said, I think it will be possible to reconsider lifting a mandate once all of our learners have had the opportunity to be vaccinated and once our burden is significantly lowered. To sum it up, mask requirements are recommended by the CDC, the Wisconsin Department of Health, the Washington Ozaukee Health Department, the American Society of Pediatrics, Children's Hospital of Wisconsin, and the Department of Public Instruction, to name a few. I would love to have a clear explanation from any and all board members who feel that their own research trumps that of these organizations. Stop looking for reasons to negate the arguments that are being made by medical professionals and start reading the words they are saying. Furthermore, how are we as a district obtaining the information needed to make appropriate recommendations to determine our specific percentages that we seem to be fixated on? Why is it inappropriate to ask families if they are willing to share their vaccination status? Obviously, this would have to be a completely voluntary request, but it seems as though it would give our district a clearer picture of the vaccination rate among our families specifically. It would be no different than if we had a positive case on an athletic team. We would inquire who that athlete has had contact with and whether or not the students they had contact with are vaccinated. Why can we not do that district-wide? We require proof of vaccination for other diseases. Why can we not do voluntary information with COVID? I can't help but wonder if this falls into a category of being overly politicized, and I find it disappointing that some of you board members, as well as possibly the administration, may be falling into that trap rather than doing what is best for our most vulnerable. I sincerely hope that is not the case, but hope is not my strategy, so that's why I'm here. Here are some strategies I hope we can consider. Require masks, if not for all, at least for those who do not have the option to be vaccinated. Revisit this policy once all learners have had the opportunity to be fully vaccinated and/or the community burden shifts significantly. Number 2, survey families to inquire about vaccination status within their households as well as their students. I do hope we can continue to have a strong working relationship within our community, and your consideration is appreciated. Thank you.
Again, I just remind you, if you could, as we're getting longer into this, keep your comments to the 3-minute mark. We're doing well. I appreciate everyone's diligence to that matter, but as we get more and more into this, the sentiments appear to be roughly the same. So please go ahead.
I'll be brief. My name is Paul Gasser. I have a daughter in high school. I live at 1903 South Green Bay Road. I'm a professor in the Biomedical Sciences Department at Marquette University and have been teaching with my colleagues new courses on the biology of the coronavirus. So I'm not going to repeat a lot of what was said. I do want to commend you for your work in the last 18 months. The things that you did worked. The policies that were in place worked. The facts that remain the same are we have a virus that travels on aerosols. That means particles that we breathe out, that we exponentially increase when we speak and when we sing and when we yell. We cannot see these particles. They don't fall to the ground in 6 feet, all of them. They float in the air column for hours. That's a fact. The virus can be spread by people who are not symptomatic. That's a fact. So we could be spreading it right now. The virus doesn't make everyone very sick, but it makes some people sick enough that they die. That's a fact. The new fact is that the virus we're dealing with now is 5 times, or at least twice, more transmissible than the virus we were dealing with a year ago today. The Delta variant has an R value of 5 compared to that of the original variant that had an R value of 2. That means one infected person is likely to infect 5 other people. This is why you're seeing huge increases in emergency room, ICU occupancy. They're not all kids, no, but every child that you look at has a family. And you can't tell from looking at that child if their family has an immunocompromised person who cannot get the vaccine. If that child has an elderly patient who has a less robust immune response to the vaccine. If that child has a family member who is now 8 months away from its original vaccination and therefore is now tapering off in its efficacy. This is a dangerous, very effective virus, and we're human beings. We have a brain, and we teach our children with everything we do. And so some people say it's scary to wear a mask. I say we're smart. We're human beings. We have a virus that's a deadly enemy, and so what do? We use the thing that we have that it doesn't have, our brains. So we use masks because the data tell us that the stuff that's coming out of our mouths is blocked, at least in part, by the barrier we put physically in front of our mouth. We use vaccines, but there are many people who will not or cannot be vaccinated. So you have to do the simple, not even really difficult thing of mandating masks. Maybe not popular, but it's much more popular than hospitalization rates increasing in Ozaukee County. Thank you.
My name is Tracy Leto. I live at 1757 Pine Court. I will try to be brief. I sent you guys emails, lengthy ones. Hopefully you had time to read them. So I'll just reiterate a couple points. The breakthrough cases, I know the CDC says that's rare, but they are only tracking ones that result in hospitalizations and death. So that all of us who are vaccinated, we could have a breakthrough case, not know it, spread it to others. That could be concerning in the school, even if the teacher's vaccinated, they're unmasked, spread it to the children who bring it home to their families. Most everything else I wanted to touch on has already been said. I sent you guys the research that shows that masks work. There is a lot of it. One of the documents had 10 pages of scientifically backed evidence. I hope you guys read it. I actually read it all. I learned a lot about masks, a lot that I didn't know. And one main thing is that the main thing that works about masks is source control. The person who has the virus, it limits the amount they breathe out. That's why it's important that everyone wear one and that we don't just make it optional where the parents can choose if their kids do or don't. If we do that, the kids that are wearing the masks are actually protecting the children who are not wearing the masks. And the kids who are wearing the masks have some protection, but it's minimal. I mean, for masking to work, everyone has to wear them. And like I said, I sent you the research. You read it. You'll be shocked. It's amazing. So that was my main thing. There is scientific research supporting that masks work. And on a personal note, I also want to commend you guys on the job you did last year. My children, I have 3 children, 2 of them are in Kennedy. I kept them home to do virtual school last year, which was unbelievable. Their teachers did an unbelievable job. My mother, I'm the caretaker for my mother who is elderly. She has advanced heart and lung disease. We still take care of her. She is vaccinated. It has been almost the 8-month mark. Her doctors say she has to wait till October to get that 3rd booster, even though she's a high-risk person. And so again, as far as emotional concerns for the kids, we teach them, like the gentleman before me said, that wearing a mask is smart. We do it to protect others. We do it to keep our family safe. And so it's scary to them to think they could go to school and bring home a virus that could really hurt a family member that we love very much. And I can understand where people might say, well, that's one case. But it's not. We all have elderly parents. We all know people who have situations. I mean, it's very common. So just on a personal note, I ask us to be sympathetic and empathetic to people in our community who are in these situations. Lastly, aside from we do care about kids, I know you guys do, but let's pretend we didn't care about if the kids got it or if it spreads in the community, because most people will be okay. My husband and I are small business owners. We're also landlords. From that point, I can tell you, we don't always like what the CDC has to say, right? The eviction moratorium has wreaked havoc in our household. We own a barber shop. We have had to re-implement measures there. My husband hates wearing a mask. He will and there's no law or mandate stating he has to, but he started wearing the mask again in his barber shop to protect his customers, to protect his kids, to protect our parents, and selfishly to keep our business open. So, we have a duty to our community on that level as well. So that's pretty much all I had to say. I concur and support everything that the speakers before me said as well. Thank you.
Hello, my name is Jason Kaler. I live at 209 West Highland Drive. I had not originally come here and planned on speaking tonight, but I came across a statistic today that I thought everybody here should hear for consideration. But before I say that, I can't make this case more effectively or more intelligently than Paul Gasser just did for you. He read you his credentials. I mean, no one in this room knows more about what we're dealing with than he does. And that should be incredibly influential to everybody listening. But some of my other friends have made great cases and cited statistics for you about how much worse things are now than when you all made the correct decision last year about masks in schools. But I'm just going to say there's a stat I came across today. There's actually 2 of them. The first one is, in the last week, the period from August 13th through August 19th, according to the American Academy of Pediatrics, 24 children in this country have died of COVID. 24 have died in a week. The other statistic is 1%, 1 in 100 kids that are infected with COVID will be hospitalized. That is not nationally, that is in the state of Wisconsin. 1 in 100. So I just want to ask everybody to look inside yourself and ask yourself, if we do not put masks in place, especially for those kids that have no choice but to come to school unprotected by masks, they have a choice, but they don't have a choice what their students around them do. If that's not required, what are you all going to do if one of our kids in this community is hospitalized with COVID? And worse yet, God forbid, what if one of them dies? How are you going to react to that? It's a very simple decision to make to require masks And you're never going to eliminate that possibility, but you're certainly going to reduce it if we have a mask requirement in schools, especially for the elementary age kids. And I just want you to think about that question while you're considering, perhaps making changes to the rules or the policies that you put in place in July. Thank you.
Hello, my name is Cameron Chrisman. I live on 1063 13th Avenue. I just graduated from Grafton High School this past June, and I have a little sister in 7th grade at John Long Middle School. As a first-time voter this spring, I was excited to go out and vote for board members who I felt would have my little sister's best interests in mind. Now I am concerned for her safety, as well as the kids throughout the district. And I'm left feeling disappointed with the choices that are being made. I would encourage you to please reconsider the decision to make masks optional and make them required to protect all students. Remember, stay safe to stay open.
Good evening, Jennifer Shimon, 1512 Audubon Avenue. I spoke last time, so I'm going to keep it very brief. I gave my emotional appeal last time I was here, and none of that has changed. I'm still scared to send my son to elementary school. One thing I did want to bring up, in addition to everything else that was said, is more specific to some of the language that was in the new proposal. It stated that students and/or staff with viral symptoms should stay home, and they are encouraged to get tested before returning to school if symptomatic. Students and staff should be symptom-free. To me, this is very weak and vague language. I'm really concerned about people being encouraged to do things. It's just a very weak stance, so I'm concerned about the quarantine language that's out there, in addition to the masks. Thank you.
Hi there, my name is Kristen Decker. I live at 155 High Forest Drive in Cedarburg on the outskirts of the Grafton School District. I have two children, both of which are in Kennedy. My youngest will be in kindergarten and my oldest will be in 2nd grade. We are planning to mask at the start of the school year to keep ourselves safe as well as those around us. I do have practical concern that my youngest will fall victim to unmasking of fellow classmates in the classroom just per modeling. It's just a reality of her age. I have reviewed the 21-22 school year plan. I can't help but wonder if we're making the COVID mitigation planning more difficult than it needs to be. To me, there appears to be an opportunity to simplify. By following the mandatory indoor masking recommendation of the CDC, the American Academy of Pediatrics, the Wisconsin Department of Health Services, and the Wisconsin Department of Public Instruction, DPI, as well as the strong guidance from our local public health department. Why complicate our decision-making process, our day-to-day operations as a district, let alone our lives, by instituting a complicated if-then scenario plan that invites kids to get sick with COVID prior to taking recommended action to mask in our schools, compromising the academic progress of children by sending them home for up to 10 days for any viral symptom, which may be unrelated to COVID. Do we feel that our expertise is greater than the expertise of these entities? Do we feel that are we so rooted in avoiding masking that we rebuff the hard reality of the situation right now, which is that we are at a high COVID transmission, not only in our county, but in our school district boundary? The CDC, the AAP, the DHA, the DPI, and the Public Health Department have already done the work for us to recommend what's safest for all people in our schools. Let's lean into that, Grafton. Let's lean into that. I support implementing mandatory indoor masking in our schools starting day one of our 21-22 school year. Thank you.
Hi, my name is Sharon Rehack. I live at 790 Wild Duck Court in Grafton. I've been a resident here for 5 years. I have 2 boys at Kennedy, 5th and 3rd grade, and I'm also the vice president of the Kennedy PTG. We have loved our experience at Kennedy, and last year worked really well with us with the COVID guidelines, and we didn't really even skip a beat. It was full steam ahead. We were very comfortable. I came here tonight for my kids who don't have an option to get vaccinated, to represent families who are scared to speak up, or parents who are worried to be indoors with people who might not be vaccinated or wearing masks. I agree with the parents that have spoken up tonight. I agree with them wholeheartedly, and I'm asking you to put a mask mandate in place, especially for the elementary schools where the kids have no option to get vaccinated. I agree to be proactive instead of reactive. Thanks.
Hello, my name is Chris Johnson. I would live at 821 8th Avenue. I have a 2nd going into 3rd grader. This always seems like one of these meetings where everybody's talking at each other, trying to break down some walls here and do a different exercise. We might be doing something a little bit with a hand raise, somebody hold up a number. I work in a facility that we base all our decisions on risk. Okay, it's called a risk prioritization number. Okay, it's a tool that we use. I work in a medical device and food and drug manufacturing. Okay, I've done it for years. Okay, so and this tool allows us to decide, do we need to take mitigating actions to lower this risk of this food, of this medical device, of this drug. Okay, and you use 3 different numbers. One is occurrence, and you rate it on a 1 to 3. The second is ability to detect, and you rate that on a 1 to 3. And the third is the severity. You rate that on a 1 to 3, okay? Use a matrix. 1 times 1 times 1, your severity is 1, okay? 3 times 3 times 3, your severity is 27, okay? So anything between 18 and 27, your severity is high. Anything in the middle grouping, your severity is medium, which is a yellow, and anything 9 or less is a green. You've mitigated your risk to your product, to your medical device. You can even, for food, it's specific to people. You've lowered your risk to the consumer, okay? So if we take that right now, and let's compare COVID last year to this year, okay? So last year, the occurrences were really low, right? So we're gonna call that a 1, right? And I don't know if everybody can agree with that. On the occurrence, we were very, very low, right? So that's a 1, right? Ability to detect, that's always been kind of a harder area, right? That's probably a 2, right? And severity, well, we all know that COVID is very severe to some people, right? So that's probably a 3, right? It can kill you. It does have a high severity rating, okay? So if you take 1 times 2 times 3, that's 6, okay? So now if we are asking this time that we are going for occurrence, right? We know that the numbers are up. We've already talked about that, right? Our occurrences are very, very high. That's a 3 for occurrence. Ability to detect. That ability to detect, as we've already talked about, is very, very hard, right? We're speaking out. You can't see these particles in the air. It's not like you can see them floating around. I'm going to avoid it like a dodgeball. That doesn't work. All right. And then 3, the severity, right? We all know that the severity can be high, but we don't know how each one of us reacts to the coronavirus, correct? So that severity is also high. That's 3 times 3 times 3. That is 27. That is the highest severity rating that you can get. And I'm just trying to break down all of this data into a smaller risk. And this is what I do every day. I break down things into a risk mitigation. That's where these masks are coming into play. And that's why I'm here tonight, is that this is my mitigation. And that I hope that this board will see that at least for the kids who cannot get vaccinated, that this is their only form of mitigation. They cannot get a vaccine, where as adults, we have some other form of mitigation. So with that, I will leave you. And if anybody wants to know more about those numbers, we can talk about that. Thank you.
Hello, my name is Morgan McCraw and I live at 1244 Audubon Ave in Grafton. And this year I'm going to be a 5th grader at Woodview Elementary. I'm speaking as well for my 3rd grade sister when I say I'm here to give my opinion on why mask mandates across elementary schools should be demanded. And here's why. I was a virtual 4th grade student all of 2020 and all of 2021. Almost 2 years because of my grandfather who has stage 4 pancreatic cancer, and in awareness to keep him safe, I kept a virtual schooling. I wasn't sad though. I was excited to be a helper in my community and keep everyone safe from COVID-19. But although I'm going back, I don't want to go back in my last year of elementary and not feel safe. Because many children and parents chose not to wear their masks. And I get it if the school district would do an optional mask mandate for middle schoolers and high schoolers, because most of them are fully vaccinated. A few concerns that people that don't agree with this opinion are at 2, the chances of your child getting COVID are very low, or being hospitalized. I contradict that point, at least for right now. As of August 12th, over 4.41 million children have tested positive for the virus since the onset of the pandemic. It's the 23rd of August. What I'm trying to say is that COVID-19 is rising in children, and it will only rise in students as school starts. Ways to prevent this? Telling everyone to wear a mask. Remember, if you have to tell your child to put on a mask or wash their hands, it's for the importance of keeping students safe. And the number one most large problem is that people against this opinion is this. My child doesn't want to wear a mask. And I get it. I went to school for 2021 of field day, and it was rough. But every kid has to remember, it's got every student every day. As my experience with my grandfather with cancer, I do it for him. Others need to remember to do it for their loved ones, family, friends, teachers, and their health. My last argument is that all the younger kids, such as 5K through 2nd grade, even if the CDC came out with the vaccine for kids, they're so young, and they haven't yet. So from now till whenever a better future comes, when vaccines have come up for children, we should have to wear our masks for you and for others. Every student, every day. I'm Morgan McCraw.
Hello, my name is DJ Herrenbrook. I live at 461 Lake Bluff Lane in Grafton. Obviously not going to be with the norm of what a lot of people are kind of going forward with here. I would like to thank all the school board and the superintendent going forward with rational thoughts in addition to statistics versus some of the fear that's been kind of going around. People have stated of this evidence that's been affecting kids giving COVID to others. I'd like to see where that data is, because as far as I'm aware, there's been 0 known child to adult transmissions in school. Everyone continues to speak of contraction or case rate, but what does that have to do with real death or illness? That's something to keep in mind. Children are not affected by COVID largely. Studies have demonstrated this. Masks have proven to cause hypoxia, hypercapnia, not to mention the microbes that grow on used masks. The inhibitions of one's immune system also to function properly. Children with normal immune systems have a higher chance of dying of lightning strikes than COVID. There are about 75 million children less than 18 years of old within the U.S., and between 2020 and July of 2021, there were only 335 deaths in that same time frame, of which during the same time frame, there were 809 that had died of pneumonia. So where's the rational causation that we are trying to attribute to this? So seeing those numbers, why is that such a concern for kids? We are not and should not be concerned about case rate, it's death rate. If 99.97% of us contract any disease without any harm, what is the harm of that? Whereas the outrage for swine flu when it came around in 2008 or 2009 that affected more children than COVID death. Masks, when not worn appropriately, have little effect. The distance of 6 feet is without merit. The CDC says so. As was noted already earlier, these are aerosolized particles, of which we may need up to 30 feet. Mask mandates in other countries have not worked. There are many proven graphs that have these from European studies that show when mandates were initiated, case rates continue to rise. Other countries have also had zero mask mandates, of which some of them, the contraction of COVID between children and student was even lower than the general population. So how is that possible? Because it makes you wonder. Cloth masks also have little effectiveness. Most of the children within school do not wear N95s at school, so that also is not showing their effectiveness. Again, what we're asking for is just that this is about choice. Anyone that wants to wear a mask can wear a mask. If they want to wear a hazmat suit, that is their choice. Again, for those that worry about health concerns at home, they can wear a mask for those that they are potential of risk to them. I know that there are many out there that feel the same as I do. They're just not as vocal as others. I work at Columbia St. Mary's Ozaki. I've worked in the ICU there for about 14 years. I got to see a COVID death of a patient without comorbidities. That doesn't mean that I'm saying that it isn't out there. It's just not something that I've seen. I also ask others, how many people have visited a hospital in the last 2 years? Have any of them been mandated to wear an N95 or respiratory masks while visiting? Do you see any of the entire hospital staff wearing either of those around the whole hospital? The answer is obviously no, so that might make you wonder why. Thank you for your time.
My name is Gretchen Wieselman. I live at 231 West Althea Drive in Grafton. I was not planning on speaking this evening, and you can tell I'm not dressed appropriately, and I'm going to cry through what I'm about to tell you. I just spent the last hour and a half preparing for the football game concession stand this week. That's why I'm dressed horribly. And I'm here to pick up my kid from volleyball practice. But I feel like I must speak after this last speaker. My 11-year-old daughter had COVID this year. She was hospitalized at Children's Hospital. She still has no sense of taste or smell. Which means when she's cooking something on the stove, she can't smell if it's burning. She can't smell her own body. She can't smell if her shirt smells clean. She has, difficulty in science class if they have to smell something. I'm sorry. I'm a registered nurse. My children will be masking at school this year, regardless of what your recommendations are, because my 11-year-old still is not protected. I don't know how long she's going to be protected, having been diagnosed with COVID. I have no idea if she's still protected from it or not. She has to continue to follow up with the hematology department at Children's until November because she was that ill. I don't wish it on any child. And we wear masks to protect other people. My high schoolers are going to wear masks to school who are vaccinated to protect their 11-year-old sister who can't get vaccinated. I'm just praying that you consider requiring masks regardless of age. My high schoolers can still come home and expose their little sister who cannot get vaccinated yet. who we don't know how she's going to react if she would be exposed to COVID again. We don't know. I don't know if she'll make it. We don't know. That's the scary part, the unknown. None of us know. Not one of us in this room know. So I just ask you to consider requiring masks for all ages, not just those that are unable to be vaccinated. Thanks.
Hi, my name is Sarah McCraw. I also live at 1244 Audubon Avenue. First off, I would like to congratulate the school district for the excellent job you guys did last year in order to keep us safe and open. That was phenomenal. As my daughter mentioned in her speech, my father was diagnosed with stage 4 pancreatic cancer 6 weeks before the state shut down. Good times. No. My children had to make a sacrifice, which is to miss an entire year of school so that they could see their dying grandfather. And now here we are. They're going to go back. They're going to mask up no matter what you guys decide and have a great school year, hopefully, right? As safe as possible. But what really strikes me tonight is the earlier comment of a casually nonchalant written off number of only 335 children have died. What if that was your kid? That's just, oh no, just to be like, just a couple of hundred children died. I don't want it to be my kid. I would never in a million years wish that on any one of you. So it's quality, not quantity, right? And these are children. We have to protect the children, right? They're not able to be vaccinated. So as you guys are working so hard to be the 12th school in America, because you are, continue up that excellent work. And that also includes keeping in mind the public health of your youngest clients, okay? So please, strongly consider it within at least the elementary school to make it mandatory. Thank you.
Any additional comments this evening?
My name is Tony Crick. I live at 1502 First Ave. I've got a second and a fourth grader at Kennedy. We were virtual for 3/4 of the year last year. We chose to go back because of the mandatory masks at the school. And we did send the kids to summer school this year masked, but there was not many people that were wearing masks, and we got a lot of questions about why. And we've talked about we protect our body, and other people can choose to make those decisions. But in second and fourth grade, there's a lot of peer pressure, or he's not doing it, I don't want to do it. And I can talk to them all day long about what they should be doing to keep themselves and others safe. But I'm fear that they will take it off, and it's a whole big problem going forward. So I really hope that we can do mandatory masks in the fall. And I'm in here to show my support for all of the people that spoke up with all of their facts and numbers. And that's all I have to say tonight. Thank you.
Hi, my name is Jacqueline Trait. I live at 1742 11th Ave, and I'm also here just to show my support for all the people that have spoken today. And I'm here to strongly encourage you to continue to follow science-based practices and advocate for mandatory masking in the elementary schools.
I'm Jessica Brunkwell, and I live at 626 Maple Street in Grafton, and I am just here to support the mandatory masking.
My name is Rachel Rush. I live at 1929 Blackhawk Drive. I have 4 kids in 6th, 4th, 2nd, and 5K. I'm also here to support mandatory masking.
Hi folks, my name is Ratish Nambathuri. I live in 1926 Kiowa Drive, Grafton. I have a 6-year-old who's going to be a first grader at Kennedy this year. I'm also here to support all of the parents here. Would ask you guys to consider mandating the mask. I go to work up at Kohler in Sheboygan. We mandate masks. So if vaccinated adults are required to wear masks, I don't understand how unvaccinated kids are not required to. So, thank you.
Any additional comments this evening?
My name is Stephen Butts. I live at 2130 Chapel Court. 3 kids in the district. Just a couple of thoughts. When this thing started, I was one of the few who had toilet paper because I was afraid of this. And in February, I stocked up, and February 20. And we went like almost 2 months without leaving the house, all 5 of us. I actually was sitting on the front stoop in late March, wiping my groceries down with COVID or Clorox wipes. But over time, and seeing the results of the pandemic, I became less afraid. And there's a lot of fear in the country, there's a lot of fear in this room, and I am not unsympathetic or unempathetic. I have an elderly mother, father-in-law's got Parkinson's. Don't separate the anti-mask, mask, caring, uncaring. Everybody cares. I've become less fearful of this as I've looked at the numbers, tried to be dispassionate about it, and I've become reassured. There's always an element of risk. I let my kids bike to the pool in Grafton. More kids drown. It's 345. Yes, if it's your kid, it's horrible. If your kid drowns, it's horrible. If your kid gets in the car accident, it's horrible. More kids died of the flu in 18 to 19 school year than have died from COVID in a year and a half. They're remarkably, oddly resilient or resistant to this. Fighting that fear, I think, is possible. Fighting the virus is not. I did a lot of reading into studies, and this thing has gotten so politicized, and I'd read studies that say masks work, and that's proven for sure. And then I'd see studies like the Danish did a study in November of last year, 40,000 people, big numbers, and marginal results, nothing. It was not worth it. Sweden went maskless, no lockdown, their students, no problems. Gentleman mentioned there's been no documented case of transmission from a student to a teacher in the world. So I became less fearful. I started looking at it from like a historical point of view. And I went back to the Spanish flu of 1918. And the mask studies, before it got political, and I asked you, because you don't convince people. You don't convince people in an argument. They have to convince themselves. They have to get there themselves. So I ask you to look at these studies before it got politicized, before we drew our lines and chose teams. The SARS episode, MERS, swine flu. Go back to the Hong Kong flu of 68. Go back to the Spanish flu. It runs its course. There's 3 spikes. It's going to get worse. We're going to have a 3rd spike. And masks and plastic partitions are not going to stop it. What convinced me about the masks, though, because all the reading I did, I'm not a doctor, and so I read about the studies, I read the opinions of the studies, right? But I did do thorough research for months. But what convinced me was that, assume the masks work argument. 2 speakers managed to speak tonight without touching their mask. If masks work, they should be treated as biohazards, that put in the bag and sealed. But we all touch our face. We touch the masks, kids are always pulling them off. Even if they worked, they don't work because we're not disciplined enough like doctors to, oh, I just scrubbed. So even if they work, they don't work. At that point, I was like, I'm convinced. You watch, you look around, you see how many times people touch their faces, masked or unmasked. So that's what convinced me about the masks. The other thing is I've had extended family pass away from COVID. All anecdotes are tragedies, but they're a lousy way to make policy. You just can't do it. It might seem heartless, but it's not. Anecdotes just are not the way to make a determination for thousands of people. And then last, I'll try to be quick here. I kind of find the representation here tonight, what is it, 30-2, sure does not represent the community. You guys know the community is not this overwhelmingly. I was expecting a split thing here. Thank God, it's like I've never come to a school meeting before, probably will never come again. But thank God I did come because I'm amazed at the unequal turnout. Because I mean, you look around, no one's afraid of this to the point of wearing a mask everywhere. Those who are most pro-mask have shown up. Most everyone else is just the Yankees are playing the Braves tonight. There's a game on or whatever. And then last but not least, and I've had a hard time figuring out a way to say this without sounding like a threat. And I don't mean it because I love the Grafton schools. They're highly rated and all that, and my kids like it. But there reaches a tipping point. One of the numbers that have increased the biggest in the whole pandemic era is the rate of homeschooling. You push CRT, which I know is not the topic tonight, but mandates for vaccines and masks, you push, and we're just gonna walk away. And at some point, the district will get hurt by that. Funding levels dictated by population, what have you. There are other games in town. Those are my thoughts. Thank you very much.
Hi, my name's Amy Johnson. I live at 821 8th Avenue. My daughter is going to 3rd grade this year. Wasn't planning on speaking, but after seeing all the moms and dads speaking up for all of our children out there, that I thought I'd come and share my feelings on this. We've been in Grafton, living in Grafton for 2 years now, and basically the first year that my daughter was able to go to school and make new friends, she was there for only half a year. So the fact that, she didn't get the chance to make new friends, we kept her home for the whole most of the year, the 3/4 of the year for 2021 to virtual because we wanted to keep our family safe. My mother-in-law has MS, my father has diabetes. For her to go see her grandparents, we wanted to keep her safe and then them safe. And then especially me, because I had some underlying health issues too that I've noticed, and I'd rather be safe than sorry. So basically what I'd really ask for you is to just, dig down deep and make sure to see what you want to see our kids safe. You want to be able to not see the spikes go up or anything like that with the kids going to hospitals or anything like that, but please, help us feel better, feel less worried sending our kids to school and be able to get the social lives that they need with their kids, because the fact that you're not giving them the options to even do virtual this year, if they have a medical reason, they don't have that option. Yeah, they could do homeschooling, but that's still, they're missing that socialization that they need. So this is very important if you could bring that mask back. Yes, some kids have a hard time wearing it, but you know what? Kids are resilient. They actually do better than the parents. My kid, she'll wear hers to bed if she wanted to. We don't have to force her. She is really good about wearing it. And then the fact that she doesn't complain about wearing it. So I just want you to guys just look at all these parents and just talking about this, and please change your mind about this and make sure this just to make the right decision. Thank you.
Any additional comments this evening? Thank you all very much for your comments and your thoughts and your perspectives. Of course, the next item on the agenda is the 2021-2022 school year plan. And pertinent certainly to all of the comments made this evening. So with that, I'm going to turn it over to Jeff, just by way of process, I guess. Jeff will go through his presentation, or administration will go through his presentation. There will be discussion and Q&A from the board, and then we will look to possibly take action on the plan, possibly take action on amendments to the plan or adjustments to the plan, either additions, modifications, or deletions. And at some point tonight, get to a point where we have a plan that administration can continue to move forward with. So Jeff.
Yes, thank you. So following the board's approval of the 21-22 school year plan last month, the administration has worked to provide details for the board's approval. So this is similar to what we did last year. If you remember, we actually had a special meeting in August because we met in July. We had a special meeting in August to just talk about our plan. So we'd worked with teacher leaders and so forth and came up with some various protocols and mitigation factors that we had the board review, and then they approved. So we're going to be presenting some slides tonight that were presented last month and were approved, as well as some recommendations of how we've been implementing the plan. I've heard people talk about looking at those different checkpoints that we've implemented. We also hear that, it's correct that after our last meeting, there was updated guidance from CDC, American Academy of Pediatrics came out the next day, and DHS that's come out since our last meeting. We reviewed all of those recommendations, whether it's the health department as well, which we'll showcase in a minute as well. And administration continues to look at our local data. We continue to look at what the external data is, whether it's in our zip code, whether it's the county. Some of those pieces, we will have some slides that show what our data look like when we'd spiked in the county the most in November and December, and what that looked like in our own school system. And looking back to last year, we started the year being in that moderate level, and thinking that, well, if we get to that high level with the health department, then it will be such big community spread, not only in the community but also in our schools, that we'll have to shut down. And that never occurred for us. We started the year on, remember, first day of school at the high school, we did have someone come in that wasn't feeling well and ended up having COVID. And next day we had a similar thing. So it took a while for parents and to buy into some of those mitigating factors, to make their correct choices of saying, if someone is ill, then you have to stay home. That's what we did last year. If someone was sick and had multiple symptoms, they had to stay home. It's something similar that we're recommending this year. And so we'll walk through some of those slides. Laura will walk through some of the pieces that go with it as well. But so some of these pieces that are the same, we continue to talk about health and safety, quality instruction, efficient and safe operations, flexibility and responsiveness. We've updated this slide to show that the burden level has now moved to high in Ozaukee County. Washington County is still high. Trajectory is decreasing in Ozaukee County. Among residents age 18 plus, 72% of Ozaukee County have one dose, 68% have completed the series. There's a lot of talk about that 70% of herd immunity. So we see that in our county, we're doing really well at that 18 plus. Residents that are aged 12 to 17, 56% of Ozaukee County residents have one dose. Talked about this last month, so the 8 different pieces that Washington Ozaukee County Health Department has recommended for the mitigation strategies. The 5 that are bolded are the ones that we are implementing. Showed this slide last month that talked about whether you want to use the total new cases per 100,000 and use the low, moderate, substantial, or high, or if you look at the percent fully vaccinated, then that gives you the total number of mitigation strategies as well. District rationale that we utilize, it was low community spread. I changed that to say it's moved to high, recognizing that that's where it is in Ozaukee County. We do have a high percentage of vaccinated staff, vaccinations available for students age 12 and up, limited spread of COVID in the school during the 2021 school year, and no COVID cases in summer school with no required masking and limited social distancing. A lot of discussion we've had about those students that are under 12 and the fact that there isn't a vaccine available for them. The discussion that we've had, though, is that there's no checkpoint of knowing, well, what mitigation strategy really is helping keep people from not getting COVID. We have a number of mitigation strategies that we utilize, and so we were in that boat last year. We're at the spring, and I applauded the board for not hearing pressure or moving forward and pressure of moving away from masking. But at the time, we didn't know. And I remember the logic that we had shared as an administrative team is, why would we change the path that we're in? We're doing well. Other districts changed at the end of the year. Our concern was, would that, if we changed in the end of the year, would that have resulted in students missing year-end activities, experiences, all those different pieces that are memories that they wouldn't be able to get back. And so we didn't recommend that. The board did not move forward on its own to do that either. But there isn't really a checkpoint of, if we start with masks, then when do we say that we're doing well and we should reduce those masks? I appreciate the one person's comment who talked about, looking at that 2-week period and looking at it in a way that sort of have a checkpoint that goes with that. But there isn't anything that goes with that out of all these recommendations. And the recommendations that are being made are based on national data. Those are based on pieces of schools that don't have, the fortunate that we have of having a community-supported referendum that allows us to have MERV 13 filters, the ability to do various pieces with our forced air that others aren't able to do, and the community input and the community buy-in that we've had in our district. And so those are some of the factors that we've looked at. We talked about this last month as well, that face coverings are optional indoors. Outdoors is what was approved. The federal mandate still, I think it's an executive order, actually, it shouldn't say mandate, but the executive order requires that face mask coverings are worn on buses. That we continue to do that now, whether students are going to an away sporting event or competing in something on a bus, they need to be wearing that, and we've done that even as we've had activities here before school began. So Laura will walk us through some of the pieces that are the same, as well as some of the pieces that are different, or not necessarily different, but are maybe more the bullets underneath the plan that the board approved to get feedback.
Like Jeff said, some of these are going to be points that you approved last July, and other ones are going to go into a little bit more detail, and acknowledging that what are we going to do if we do have an increase in COVID and quarantine cases. So to start out with contact tracing, just like last year, parents are going to be notified if there was a specific classroom that had tested positive. This time around, though, families are going to decide if they want to quarantine their child or not. Students who are self-quarantined will be provided the links to the classroom videos within 24 hours. It's going to be view only, and it's not going to be synchronous interaction. Quarantining, students who test positive will follow the health department guidelines for isolation, just like last year. Students who are isolated due to a positive test will be provided the links to the videos within 24 hours. Access, again, will be view only. Positive household contacts. So when a person in a household tests positive, all members of that household must quarantine 7 to 10 days beyond the positive person's isolation period. That's no different from last year. What is a little bit different now is that vaccinated members of the household may return to school after the positive person's isolation period ends. If the positive person can isolate from others within the household, meaning they're not sharing any spaces together, they're not getting together, they're not having contact with one another, then the vaccinated individuals, we're saying, in the house may return to school immediately if they are symptom-free. Students and staff with COVID symptoms need to stay home for 10 days and return to school before that 10 days can happen if they receive a negative COVID test through a reputable laboratory. We're not going to be taking home tests as evidence of that. Or we can, if we get an alternative diagnosis from a healthcare provider, that the staff or child can return to school and there's no concern for COVID. Students and staff, just like all other years, should be symptom-free, unmedicated, no fever, for a minimum of 24 hours before returning to school. And just like last year, students who were presenting with viral symptoms at school, we're going to have them mask and wait in isolation until a parent or somebody can come and pick them up from school. We're going to continue to maintain a district dashboard to monitor the COVID cases so that, updated daily with new cases by staff or students by each building. And just like last year, again, we're going to have district-wide notifications to be sent whenever there is a positive case with our staff or our students. Virtual learning will be only provided for students who submit a homebound application and have a medical excuse from a physician. These students will have the option to return in person second semester. As of right now, we've only had 5 students whose families applied for this. We are still waiting on some of those medical excuses, but virtual instruction will be synchronous with the live interaction between students and their teachers in the regular classroom. Virtual students are not going to be eligible for in-person extracurricular activities, and there are going to be some courses that they may not have access to. Temporary virtual learning, it's going to be view only. So for students that are quarantined due to a positive COVID test, a link will be provided within 24 hours of notification to the district. For non-COVID illnesses lasting more than 3 days, the link will be provided on day 4 of the absence. In the case of extended medical absences, such as surgeries, the link would be provided within 24 hours of request, and we are not going to be providing a virtual learning option for students that are on vacation.
And you may recall, we spoke at length about this at the last board meeting about the reason why the view-only piece is in place is because of just the impact that it was on our staff. The amount of work and stress and effort that they put into having it be synchronous really was took a heavy toll on our staff. When we met with staff at the end of the year, that was one of the pieces that they really requested, unless there was a significant reason for someone to need that, to be able to sort of not be having to work 2 platforms in person and virtual at the same time, just because of the load that it was on our staff. So we're honoring that.
So back to regular school schedules, events, and activities. We're going to eliminate social distancing restrictions, such as cohorting and 6 feet of distancing. Buildings will be reopened to visitors and classroom volunteers, and field trips will be allowed once again with principal approval. In the lunchrooms, so elementary students will still be cohorted with their class. They'll be sitting on individual stools. Meal checkoff sheets are going to be used, so students don't need to use the PIN pad to enter their PIN number. At the middle school, students are cohorted by grade level over 3 lunch periods. Barcode readers are used at both the middle and the high school, so again, they don't need to use the PIN pad. At GHS, the students will have reduced capacity at tables with the option of additional, more secluded tables. And this is again going to be over the course of 3 lunch periods. Items not served by adults will continue to be wrapped. However, students are going to go through the lines and they can make their own lunch item choices. Again, continuing mitigation measures, we're going to disinfect common touch points, the nightly deep cleaning, continue with the MERV 13 air filters, and the switch out of air at 50% during the day and 100% flush early in the morning. And then hand sanitizers will continue to be available in classrooms. So checkpoints. All right, in order to safely respond to increased COVID activity within our district, a shift in school operations or procedures would occur at a 5%, 10%, and 20% positivity rate in a single classroom for grades 4K through 5, or a combination of positivity and quarantine at a grade level building or extracurricular activity at all levels, at elementary, middle, and high. Okay, so before you start doing the mental math, here is just an example of what it would look like to reach 5%, 10%, and 20% at a classroom level. So if you had a class of 25, 5% positivity rate would be 1 student, 10% would be 3, and 20% would be 5 students. And this is what it would look like at the grade and the building level, and this is based off of our current numbers of students by grade level. So you pick any grade level, like 4th grade, there's 79 students, so 5% positivity rate would be 4, turn this way, 8% for 10, 8 children for 10%, and then 16 for 20%. Or if you want to look at the whole building, for example, like at Woodview, there's 453 students. If at any point we have 23 students that are either ill with COVID or quarantined, that would trigger a 5% change in plans, and 10% would be 45 students, and then again, 91% would be the 20% level. So we looked at last year, some data that we found that the highest rates of both our positive and our quarantine students happened between that November and December timeframe, and this is an example of the high school during that time frame. The high school reached what we'd consider a 5% positivity or quarantine rate several times, but they never hit that 10% mark. Next Next slide shows John Long. Again, they reached that 5% several times, and they reached 10% once, and it was 8th grade that hit that 20%, and that's when we had made them virtual for the 7 to 10 days. And at the elementary, a couple of times they reached that 5% positivity, but they never reached the 10% either, or by building. So what's going to happen? All right, so this is our proposal for 5%. Face coverings are recommended regardless of vaccination status, and all adults would be wearing face coverings. At the 4K through 8th grade, if a grade level or building-wide, masks be worn while entering and leaving the building and during transition time, so during passing time, on their way to lunch and back. At the 9th to 12th grade level, there's just so much overlap between grade levels, so any given class would have, it could be a 9th and 10th grade, it could be all 4 grade levels. So it'd be a lot more difficult to kind of tease out by grade level, so we are looking at just doing building-wide. So if that were to happen, masks would be worn while entering and leaving the building, and again, during all transition times. In addition, cohorting would be utilized to reduce the interaction of different groups of students in the building, and required close contact quarantine within 3 feet of the positive case, unless those students were either wearing a mask or vaccinated. So they'd be quarantined for the 10 days without a test, or they could do the 7-day quarantine if they had a negative test result. So at the 10% level, face coverings would be required regardless of vaccination status. If a face covering mandate is enacted, it would last for 14 days, which is roughly the incubation period for COVID, and then until the positivity rate would drop below 10% for 5 school days. Required close contact quarantining within 6 feet, so we're widening the circle. Again, 7 days with no test, or you could come back after your 7-day quarantine with a negative test. Household members of an ill student would remain home until they had a negative test or they completed the quarantine period. And then our lunch periods would go back to the 2021 protocols. If we were to hit the 20% positivity quarantine rate, we would have virtual instruction for that grade or building for 14 days. As far as athletics, all North Shore Conference and Woodland Conference events are going to be following a traditional schedule. Questions?
Thank you, Jeff. Thank you, Laura. So I guess at this point in time, board members, I'd ask that any clarifying questions, additional information that you'd like to hear, questions you might have, so that we can have a good dialogue about the recommendations that have been put forward. And so just turn the floor open.
So just a couple of questions I can start here. So first one with the executive order for the face coverings on the bus. Is there, so that's in place now, what is the parameters that gets removed?
If the mandate were to end?
Yeah, what ends that mandate? Do we know?
My understanding is that would be the TSA. There's considerations of extending it potentially in the future, but that would come down from the TSA is my understanding.
Because TSA has that control. And then for the numbers, to get to the 5, 10, and 20%, so you said that's positive cases and quarantining, correct?
At a grade level and building level.
Okay, so define the quarantine, because there's some that, is that somebody that voluntarily opts would go into that number?
Mm-hmm.
So it can just be, so we could have one person, 20 people go out and we're 21. Okay, so that number as it gets combined is based upon just the people that are not in the school because of an incident, not anyone that has.
It could be a quarantine because of somebody that was positive in school. It could be a household member.
Okay. But early on, that would not be, we would notify a class, correct? That there was somebody, so technically that whole class could just opt, and that number then goes
To 5%.
To 5%.
Or to 10%. I mean, right? It would go to 10% probably.
Because before we get to that point, we're not doing any contact tracing.
Right, we're internally contact tracing. We are internally contact tracing, but it's optional for families to decide to self-quarantine. But we are internally tracking to see if, so similar to what we did last year, where we would have, and we showed this data that would showcase that we had examples of our positive cases and quarantines, that we would have people that were quarantining based on a positive case, but then they didn't result in having COVID. So we'd be watching though. Now we have taken away a mitigation factor. All the other factors that we used last year would be in place in that area, but we don't have a mask. And so we would see, okay, well, who are the people that would be considered close contacts, and are they developing symptoms?
But if it's optional, how are you going to get accurate data with that? I don't understand
The same way we got data last year is from the teacher. So what would happen is the teachers are still going to have to keep their class list. So you're going to have your seating chart. So what would happen last year is we'd have a seating chart. We'd get a call saying a student has been diagnosed with COVID. At the secondary level, they would wait until the bell rings. They'd have to go into the teacher and say, looking at your roster, okay, who is sitting here? Let's go back 2 days, 3 days. They went back a couple days, and then would figure out who would have been in close contact with that student, who then would have to be quarantined.
So teachers are going to be tracking, or there's going to be assigned seating right at the beginning of school? Is that what you're saying?
Yes, yep. So similar to what we had last year. So seating charts is what we had last year. Typically you have seating charts anyways, but now it's more, it can't be as fluid. So typically now you're going to be in a seating chart for a couple weeks at a time so that you can keep track of where our students sitting. Students were working in small groups last year, and so it'd be a similar situation as well now.
But the kids are not going to be masked in our situation as it currently stands, correct?
Correct.
So then they'll also be transmitting or transferring between classroom to classroom or wherever, right, all through the building. How is that? It just seems very complicated to me that they're going to have to do a lot of tracking and seating arrangements going from classroom to classroom, especially in the elementary grades.
Yeah, it'd be the same procedures that we followed last year. So you're right, it is complicated, but that's what we did last year as well, because that's what we did, is we kept track of. So even if we had students wearing masks this year, we would still have we'd still have a seating chart. We'd still be tracking to see, is this working? Like, is the mask, is all these other mitigating factors, is that resulting in COVID being spreading in our schools? So that's what we did last year, and we would continue to do that. Even if you get to that 10% and all students are wearing masks, then you'd still be doing close contact tracing, which is what we do now. That's what we did last year.
And you talk about the mitigation strategies over here with the Washington Ozaukee Health Department. We have 1, 2, 3, 4, 5. We have 8 to choose from. They said that you could use a certain number.
Trying to get back to it for you. There we go.
Right. Is there a reason we didn't choose masks out of these 8 factors?
What do you, I'm sorry.
I'm just curious, like,
Help
why
me.
choose these and not screen testing or masking? So why, like, just curious as to the rationale.
Yeah, so that was the rationale we brought last month, and the board approved that. So then that's the
Right,
that's
and
the
I'm
piece that
clarifying
goes
it
with
now,
that.
just
Right.
to see.
Yep. No, I understand. And so, like, as we said, like, we've also looked at data, we've looked at studies, we've reviewed all these recommendations that we have, and the administrative team did settle on, but that data wasn't accurate last time. The community spread was not as impactful in our school system as our local data, and our local data is what should drive it. If we were to utilize this, and if the community were to be low, but we were to immediately have multiple cases in a grade level or in a sports team, we would shut that down. We wouldn't say, well, the community spread is low, so we don't have to do anything. Like, we would use our internal data, because that's what we have that's accurate. We aren't as confident that the data that we're getting from either Ozaukee County Health Department, Ozaukee Washington County Health Department, that now is referring us to DHS's data, because those data points didn't align. So everyone's trying to figure out which data is accurate. If I look at our zip code, I can see that, but then is that are those students in our school system? Are they not? What does that look like? So we have our internal data that we know is accurate, and we code it accurately, which helped us as we were filling out for DPI, asking for instructional minutes, because we were able to say who was in person, who was virtual, who was quarantined, all those pieces. So I guess that's why we settled on the local data as being a driver for our mitigating factors.
Along that same lines, Jeff, on the close contact and quarantining, we will know definitively, of course, if somebody is self-quarantining or choosing not to. I mean, I'm assuming if they come the next day, they've been notified that they're potentially in close contact. If they come the next day, we're just going to assume that they are not self-quarantining.
Correct.
If they don't come, we assume that they are, or do we ask parents to provide us with positive information?
Yeah, we would ask parents to make that phone call to
Okay.
say, just like you would in a normal situation where a student doesn't come to school, tell us, why. There's multiple reasons. Families can excuse their kids for a variety of reasons, but we would be tracking that. We have a code that we would be utilizing for that to keep accurate records of that.
Right, okay.
And as we said, I think earlier, we said that students who do choose to self-quarantine, that this wouldn't be like, I'm going to quarantine for a couple days and then come back. If you choose to self-quarantine, then you should be self-quarantining for that time period. And you may have an issue where they come back early, but then the office would follow up to say, in the future, if you self-quarantine, it needs to be for that quarantine period.
I have a question after a 5% positivity or quarantine rate when it says cohorting will be utilized, because you're not going to start with cohorting, right? They'll be assigned seating in a classroom, but
They may be
But they're not
assigned a
gonna
lab
be-
partner, or they
Yeah.
may be just one partner, or they may be just working in a small group, like 2 or 3 or 4 students, instead of working with the whole class.
so teachers are going to be allowed to have small groups or pull small groups. Are they going to keep the small groups the same then for a period of time? Do you know what I mean?
5% level, or just?
Well, even before, like I'm trying, like what changes, it just says, like what's changing before and then with the cohorting comment? Like, do you know what I'm asking?
So I think I do. So at the 5% level, then that's when we're making sure that we don't have different groups of students in the building that are cohorting together. So you may have interventionists pull different kids together before we get to 5% to say,
Okay, so that would stop
that would, at that 5%, we would say, okay, if we need to reduce the risk of a spread. So you can see that, like, even with 0%, where we are looking at the elementary level for lunch, having students sit with their class. So you're already sitting with your students in class. Last year, when students either ate in the classroom or they ate at lunch, they weren't wearing a mask then. So now you're still sitting with your class. So we're not mixing classes together, even at lunch. But there'd be other cohorting things that we would look at the various levels to say, what does that look like to reduce that interaction of different groups of students inside?
Okay, so in some cases, it might not be that big of a difference, just depending on maybe how that particular class has been operating?
Correct, yeah, because last year, if you're in a science group, you had to have a lab partner. So
Right.
whether you had a mask on and we wanted people to be 6 feet apart for close contact, they still need a lab partner, so they had to work together. So you'd work together for a couple weeks so that if something occurred, it wasn't multiple students that were going to have to be quarantined. And so in this case, that's what we would then work with staff to be like, okay, the groups that you've been having, if you've had larger groups, whether it's 6 or 8 students working together on a project, now we need to reduce those groups to a smaller number and extend that time to be for an extended period of time so that if something occurs, you have less mandatory quarantining for someone, which is the issue that we had last year.
Is there a reason why we chose language like eliminate social distancing restrictions? I mean, can we still maintain, for instance, in the high school at lunch? I see signs on the floor, or I saw signs on the floor, I don't even know if they're still there, but why wouldn't we encourage social distancing or keeping distance whenever possible? Recognizing that it's not always the case, but it seems odd to me that we'd say we're just going to eliminate social distancing rather than let's encourage social distancing whenever it's possible. Anytime you're lining up, anytime, I mean, whatever they may be, I don't know what they all are, but is that a possibility that instead of eliminate, we encourage it whenever it's possible?
Definitely.
Going back to the 5%, just some clarification around the different grade levels. So elementary, they're in their classroom. Middle school, things are a little more loose. So is it at the grade level and building level that this 5, I'm just trying to, elementary, it's like classroom, building, right? And then or classroom, grade, building. Middle school, we're talking grade and building?
Grade and building, and then at the high school, just building.
Just building, okay.
And last year, there was if you had hit 20%, that was then going virtual. That was the same last year, like if any classroom or was that more like grade and?
That was just a grade level, and that's the only instance that we had in the district that reached that level.
Okay.
It would have been class as well. We just never had that. We were looking at grade level. We're looking at grade level is what we were looking at. So we're looking at that grade level piece of reducing that piece. I think that's where we said at the middle school, you can see where that 8th grade group.
So going back to high school, it wouldn't be class 1, you're wearing a mask, class 2, you're not. It's grade level. So how do you handle then that for, or what's the thresholds for an athletic team?
So the number of students they're on a team.
Okay, so you would just take that percentage as the same as that'd be your classroom percentage then per se.
That's the discussion that we've had as a leadership team to say, if you're part of a team and you start to get to 5% positivity, quarantine rate, or 10% or 20%, you're heading in the wrong direction. If we're not seeing that at the building level or at the grade level, but you are seeing it at that sport level, then we need to be doing something differently.
So that could be a team or a whole program.
Correct.
And then just for clarification on the homebound, did I hear you correctly, there was only 5 that applied?
Correct.
Okay, so that would have been 5, and that came out, was approved at the last one before registration as well?
Correct. Yep. People register. That was the process that they followed, was through registration to sign up for that.
Okay, and then you said of those 5, how many have their paperwork in and are approved?
About half.
On the slide, it says maintain enhanced symptom monitoring. Students presenting with viral symptoms at school will be asked to wear a face covering and will be isolated until they can be picked up or able to leave school. So when they're asked to go home, what is their requirement to come back with the viral symptoms?
They're quarantined for 10 days.
So, just any viral symptom?
Of our the COVID symptoms. So we had like the single symptoms, such as the cough, the loss of taste and smell, some of those big ones, or 2 of the other ones. So it's the same as what it was last year. So if you had multiple symptoms, or you had any of those, the biggies that were, chances are pretty good you have COVID, then you're going to be quarantined for those 10 days unless you can get a negative test.
So that's exactly what we had last year. Yeah. Yep, that hasn't changed, and they haven't changed the symptom list either,
No,
right?
The symptom list is still the same.
Yep.
Any additional questions? Any discussion, observations, anything those would like to share?
It was interesting, it was good to have the numbers from last year for us to look at relative to the 5, 10, 20%, because I think that shows you where we were at last year and how effective things were. I think this year, it's different in so many regards. I mean, it's always different. That's how last year was. It changed constantly. And I think it will again this year. And it's a matter of how it changes, and I guess I'm looking at it as I'd rather change to be less restrictive than more restrictive, and I think this is kind of a building block to things. It's kind of the reactive thing. It's, oh, we get cases, we're gonna do this, then we get more, we're gonna go this. And I'm almost to the stance, let's prepare ourselves, because I think it worked last year with all the mitigation factors. And it'd be easier to ease the requirements than to add to them. Just kind of a personal opinion.
Are you saying you would prefer masks? Is that what
To
you
some
mean?
degree, yes. Yep, I don't think across the board, but I would say unvaccinated. And I think that's might be the safest way or the easiest way versus.
Is this a time where we're
We're discussing, we're just having discussion.
And before we get there, just, pardon?
For changes? or
We're
no?
discussing
No,
first, and then we'll make changes. We're just giving opinion.
Yeah, so I guess, I mean, we, just as a matter of protocol, what's next? We can continue to discuss this, we can continue, but at some point, we need to end our clarifying questions, right? And I think, are we at that point?
I guess
I'd
that's
like
where,
to discuss.
Okay.
where I thought we were.
All right.
No, yes, we were.
Right, so then I guess,
I just needed to clarify
Yeah.
where we're at.
so for clarity purposes, and just again to reiterate the procedure, the process now, we have a plan that we've approved. Obviously, administration has come back with some changes and adjustments to that plan, right? So we've heard the updated plan, we've had an opportunity to ask our questions, have some discussion. If we're to the point now where we are looking to perhaps make recommendations, either additions, modifications, or deletions, I'd ask then that to the extent somebody is so inclined to do that in order of a motion. So if you want to make a motion, but that motion be, limited is not the right phrase, or articulated in a manner that it's either adding, modifying, or deleting to the existing policy. We'll follow the standard Robert's Rules of Orders. If there's a second, that motion will progress. We'll have discussion, and then we'll take a vote. If that motion isn't seconded, it will fail and it will die on the table. At the end of that discussion, hearing no other changes, then we'll simply go back and I'll ask for a motion to approve the plan as presented, subject to the additions, deletions, or changes that were made by virtue of past motions. Is that clear?
Sort of.
Reasonable? Sort of?
So can we discuss first and then make the
Absolutely.
motions?
Oh, okay, good.
That would,
Well, can we discuss first?
let's
I
just
think-
discuss our opinions. I mean,
Absolutely. Right now would be a good time to discuss opinions and thoughts that you have. Before we get into that perspective, I
Sure.
think that would be a good idea.
I mean, to Mark's comment, I mean, in looking at the elementary kids, and then we've had obviously a lot of discussion regarding this, and I'm in a unique situation. I have one under 12 and I have one over 12. You know, so it's, you know, the decision that I make along with my wife is gonna be the decision that we make. And I would be okay with proceeding with the 5% mitigation factors from the beginning. As far as the discussion that we've had previously last year before the mandate came out, it was, and I think it was one of the administrators came up with it, was if you're moving, you're masking. You know, so when you're coming in, when you're in the hallways, when you're moving, you know, you're wearing a mask at that point. I would be okay with adding that as more of a mask element into elementary. For the high school, I'm okay with what is presented on here. Kids have a chance to get vaccinated. And from that standpoint, I'm okay with whatever the high school. The elementary, or the middle school to me is a little bit challenging because you have a school that's split, some vaccinated, some not vaccinated. So I do not have an answer for that one.
Just to clarify, every school is split, some vaccinated, some not.
I think you're referring to who
Just the
can.
students. Just
For
referring to the
eligible,
students.
those who are eligible. is what he
Yes,
means.
Still split.
and I'm going from the student standpoint.
Yeah.
Yep.
Other thoughts?
So I was a little confused with what you were saying. So you're saying at the elementary level
The elementary, on the 5%.
to have masking while moving? If we hit 5%, is that what you were saying?
What is that's the 4K through basically fifth grade, or what's in that middle one?
So you're saying you would prefer that to be the initial one, not waiting till 5%,
Yes.
just from the beginning?
Oh, from the
beginning. To go with that second bullet point for fourth through fifth.
For fourth through fifth?
Sixth through eighth, I mean,
But that's at 5%. Are you saying before?
I'm saying day one
Day one, okay. If you're moving, you're masking.
in that second bullet point.
Yeah.
And that's what, a large basis to what our discussion and approval was last year.
So just to clarify on that, when would you consider them not needing to, like, I understand how they laid out 5%, 10%. Is there a percent that you, at what point would you say that is not necessary? Or how would you expect administration to set up guidelines for that?
From that standpoint, I mean, one, there's, obviously a vaccine was talked about today. We don't know what that timeline is. And I think we've done well in picking quarter points or semester points. I think we could choose one of those to say that we would evaluate it, but you're 100% right. What makes it go away? I don't know if we could pick anything that would make it go away before there's a vaccine that comes out.
What about tying to burden rate?
Burden rate in the school, burden rate in the community, burden rate, which one?
Well, we're not tracking it in the school, are we? That would be,
Well, you'd
that
have
would be
cases.
more at the
Track our number of
Osaka
cases. I think we
County
do track the number of cases.
per 100,000.
We track it more accurate. I mean, I think our internal data is the most accurate we have for where our students are at.
That's how you track it that way?
I mean, that's,
Did you discuss that when you're, coming up with did you talk about the low amount, like if you did that?
We did not use that piece of it. We did try to look at using the logic of if you're in a classroom, and we would have had it last year where a student, we're masked, we're doing all the things that we did last year, and students still contracted COVID. Well, if you have multiple kids in a classroom that have COVID, then a concern for us would be that, well, then we should be adding mitigating factors into it. Last year, we didn't have other mitigating factors to add except to go virtual.
Okay.
That's the only thing that we had, right? Because we had all these other factors in place. So if we're missing a mitigating factor and we start seeing an uptick and you have a couple kids in a class, or you're starting to see at a grade level things, and it could easily happen with kids that are involved in athletics or extracurriculars, where you get a large number of students in one swoop that could then impact that entire grade, but then that would be a concern for us if they were to come back and then to spread it in that grade level. So then that's where we sort of built in those checkpoints and steps of mitigating factors to come into it.
And personally, I struggle with the whole burden chart. I don't struggle with the concept of burden, but the burden chart itself. I have yet to find any information upon which the CDC based its
Where they got the
scale and
numbers,
its parameters.
yeah.
In fact, I've read 2 studies out of Sweden that at 150, that they consider that low. And on November 12th of 2020, the Washington Ozaukee County added a level to its range of burden because very few districts, if any, in fact, our own district would have been virtual 50% of the months last year because of our burden rate. And we just totally ignored the CDC guidelines and the DHS guidelines and Washington Ozaukee County guidelines at that point. We just totally ignored it because at 350 and above, we should have been virtual, 100% virtual. But it got so bad, the numbers got so bad last year that they added a Navy, critically high, not just very high, but and districts by and large throughout the state. In fact, at the federal level, it wasn't until April or May that the February, March, that the federal government started to talk about CDC and the AAP started talking about how schools should be open. And here we were all year ignoring CDC guidelines, ignoring DHS guidelines, ignoring Washington, Ozaukee County guidelines, and having our schools open and doing remarkably well.
Yeah, I think you saw we saw our own numbers, and we're seeing them here tonight too at our worst time last year. Our numbers were good. We did not see the spread in schools, no doubt.
Well, I think too is the parents did a great job with the mitigating factors, keeping their kids home when they were sick. We're all wearing masks. We were able to social distance. I mean, all these were in place to keep us open. So we did a great job last year.
All of those mitigating factors exist this year. In this plan.
Minus the mask.
It just depends on like
And
where
there's not
things
going to be
are.
social distancing. I mean, in our plan.
That's why I raised the point. Can
Correct.
we get back to some level of social distancing and saying we're going to eliminate it? Can we get back to a reasonable level of social distancing whenever possible? Masks are not forbidden. They are available to be worn by anyone at any time.
Yes, they are.
Right.
However, we do, I mean, we have many medical professionals that state masks work, okay?
Joe, I believe they work.
Right.
I believe they
And I'm
work when they're
saying-
effectively worn. And
Correct,
when they-
effectively worn.
Right.
It will be more effective if 2 people are wearing the mask,
I agree with all of those things.
right? And that's going to prevent spread. We have researchers here, we have scientists here who actually do the work that are telling us this.
I agree with that. I
Right.
don't disagree with
Right,
that.
and I'm just trying to make that point.
Right.
This is why I think we need to really consider how we're going to start the school year with something that's spread quicker than the previous COVID illness.
I'm telling you, I agree with all of the
Right.
points that you're making. And I agree with the data that's been presented and the science behind that data. I don't disagree with it.
He was disagreeing with what I was talking about
Right,
with
but-
the
and
burden.
I'm just making sure that point is made.
What's the level of social distancing that we would be at?
Social
3
distance?
feet, 6 feet, what would be the one?
I'm not sure what it is. 3, 6? What would
I
you?
see 6, I see 3.
So we use that for quarantining, so are you asking what could we
If we
do in our
move to
classrooms?
social distancing, we're talking
Yeah,
about.
sure.
I'm not proposing that we move to social
Yeah,
distancing, but
if-
proposing that we promote it whenever possible. If you're in line, keep your distance.
And, yeah, I guess what would that distance be?
It's a fair question, Jerry. I don't disagree. I don't have an answer for that.
But if we want to return to school as safe as possible, as normal as possible, I think part of these things that we were talking about is we're going to want to do that, but how are we going to do that? And if we don't have the face coverings, I think that's just giving the other kids more chance to get ill or transmit the disease. That's the problem. But I think if we do have the masks on, they'll be able to get a little bit closer to their friends, go into small groups. It'll be easier to monitor. I just think we're making a big mistake if we don't start the school off with face coverings.
When would masks then come off? Because what you're proposing is a corollary to this.
When would
Because I
masks
heard-
come
yeah, I
off?
heard tonight that it would not be until everyone's vaccinated.
It would not be until everyone perhaps is eligible for vaccination plus however many weeks past their
Sure,
vaccination.
but not everyone on that first day of availability.
Exactly.
So I mean, we're really talking.
Right, and it might be
Quite a bit after.
quite a bit after, but you know what? We're going to be safe. We're going to keep the students safe.
Well, can we
We're
have a
here as a
measure where
board.
we
We're a board.
have,
We have to keep our students safe. That's our bottom line. All
so
students.
nobody's disagreeing.
Right, and
with
I'm
that.
just being very
Yep.
I'm just trying to get my point across because I really feel
I don't
that
think
we need
anyone's really
to-
disagreeing, but we're
Right.
asking a question about, okay, so if we start with masking, then like what can we measure to be able to take the mask off? Like that was the question.
Yeah, and I
So
guess
the
that's why
eligibility-
I like the idea of if you're not vaccinated, you'll wear a mask. Now, you're gonna have
But
some
then
that,
how do you know, yeah.
you won't know, but I think that's in my mind versus grade or age or whatever it is, it's you're vaccinated or you're not. And then when you are vaccinated and you're past that 2-week time, you can take your mask off. I don't know how you do it otherwise at a grade or a building or
And whenever
whatever.
Then you would
All
mandate
different
for sure
ages.
at elementary.
Right, elementary and middle school, I would say, because when did kids turn 12?
6th grade.
6,
grade.
7?
Or some at the
Some
end.
at the end, yeah.
Yeah.
Depends.
Right.
Those kids entering, the last one should be August.
But then you have siblings, right?
Right, and then, which makes it maybe all the more reason to have masks for all grades, K through 12. I mean, if we think about it, how many people are vaccinated right now? Say we have 2,100 students, I don't know what the exact number.
That's right. Yep. Well,
So
2,000.
about 50% is not vaccinated, and that's half of our school. We have siblings we have to think about. I just think it would be the safest thing to go in, starting with masks.
On the reverse pivot. So the administration presented a plan tonight that would provide a pivot to move to masks under the theory, and I'll address, hope is not a strategy.
No.
I didn't go into this thing to review any of these plans or consider any of these plans hoping that there wouldn't be cases, because I have no illusion that there won't be cases. There will be cases. And if anyone out here can assure me that there won't be cases if we wear masks, if you can assure me that there won't be cases if we wear masks, then, we can agree that masks may mitigate, right?
But these are not 100%, we know that. right?
Agreed, and that's why on our list of mitigation factors, it remains on our list. Under the current plan, it would be a mitigating strategy at these pivot points. So I'll ask you, what would be your reverse pivot point? At what point because I think the community would want to know that, at what point would masks no longer be required?
Well, I would say, I would look at our medical experts, like our health departments. I would look at the American Academy of Pediatrics. I would look at what our doctors in our communities are saying. And I would look at the vaccine eligibility for all the students in our schools.
But Joe, I'd ask you, was it okay to ignore them last year? Because we did.
Was it okay?
We did ignore them last year. We ignored them for 50% of the time.
Was it okay?
And some of them.
Some of them.
But we were wearing masks.
True.
And we wanted to be in school because we were trying, it was a new thing we were trying. No one went through a pandemic before. So no, I don't know if it's okay or not. But we tried our best to keep school open.
I would believe that administration, in putting this plan forward, believes it's the best plan to keep our schools open. So I guess, so would it be all of those sources? So there would have to be unanimous agreement to 3 of those sources that you cited before masks would come off?
No, I'm just giving some examples. Like I said, I would look at what the medical community is saying.
Okay, so the Johns Hopkins University professor, Marty McCary, who was in the New York Times article that talked about masks work in schools, even though they didn't do a study that got sent to us.
Are these the articles that you sent us earlier?
No, this was the article that was sent to us about
Okay.
masks working
Oh,
in
this
schools,
one,
and they
mhm.
studied North Carolina and said
Okay.
studies prove that masks work, even though they didn't have another control group, since everyone in North Carolina had to wear a mask, so fairly faulty science. But this medical professional, university professor, points out that CDC data shows that more than 600,000 Americans who died from COVID diagnosis, with a COVID diagnosis in the record, 335 were children under 18. CDC has no idea whether they had pre-existing conditions or not, or whether their COVID diagnosis was incidental or causal. Research team led by him at Johns Hopkins looked at 48,000 children under 18 diagnosed with COVID-19, found a mortality rate of 0 among children with pre-existing medical conditions such as pediatric cancer. Is that a medical professional we can listen to, or is he doesn't count?
I'm not sure. I'm not looking at the article, so I'll have to process it a little bit more. What? I'm sorry.
Well, no, excuse me, this is not a public, no, I'm sorry, please, sir, this is our meeting, and we will, sir, this is our meeting, please, this is our meeting, we will continue to deliberate this discussion. This is our meeting, so additional comments.
So what was the rationale from the CDC to remove the masks or put the mask mandate back on? We've gotten the AAP and the CDC link sent to us multiple times. I'll note there's absolutely no data in those links. It's just their recommendation that they should mask students without presenting the data, even though their websites do provide the data. I guess I'd feel more comfortable if we had some sort of idea when it ends, that it would be applied consistently, that we would follow all CDC guidelines, including proper mask wearing. I assume that would be the recommendation, which would mean, per the CDC and the link we were sent, no N95s for kids, no face shields for kids. Hands would be washed immediately after a mask is removed. Reusable masks should be washed whenever they get dirty and at least daily. Disposable masks should be thrown away after being worn once. Hands washed after any handling or touching of the mask. Dirty and wet masks should be stored in a sealed plastic bag, and masks that aren't wet or dirty should be stored in a properly ventilated paper bag. I assume that would be enforced by our staff if we're going to follow CDC guidelines. If
That'd be very difficult. That'd be very difficult.
we didn't, I don't,
It worked last year.
did we do that last year?
They wore masks.
Did we do properly per CDC? I'm just trying to see if we're going to follow CDC guidelines. Is that the?
I think we looked at our own data, and I think we see our own data, and we did well, and I think it's due to all the mitigation factors we did last year.
All the mitigation factors.
Mask
We
wearing.
did. Yeah, that was, I feel, one of the biggest ones.
You feel?
Listen, man.
Other thoughts? So hearing none then, well, I see that Sean has stepped out. So we will.
We should wait.
I will also just note, I mean, I suspect, and Jeff, we removed the mask mandate in summer school, right?
We did.
And the reason for that was?
Other area districts had removed their mask requirements at the end, in like the middle of May, and had 0 positive cases as they finished their year. We did not bring that forward to the board as a recommendation I mentioned earlier, but we did, that they had 0 cases, and so it made sense to say, well, let's move away from masking, let's move it to optional, similar to during the year. You're going to have opportunities to be outside. It was a smaller sample size, obviously, than what you'd have during the school year, only at one elementary school and some at the middle school as well. I guess we used both of those buildings, but that was the rationale that we'd use to bring it forward to the board to say, here's an opportunity to, other districts have done it with success. What are the factors that we have that are working? Is masking the most important, or do we have these other factors that would help us over summer school?
And we believe that some of those other factors were of importance.
Yes, we did.
No
We did.
way to determine of equal or proportionate importance.
Right, that's correct. There isn't a case study that we have that would show all the mitigating factors we had minus mass and all the mitigating factors we had plus mass, and then do that study.
And clearly,
We don't have that.
we had decreasing trends in case counts. I mean,
Yes.
Ozaukee County did.
Oh, yes, yes, correct, across the county, correct, yes.
And I-
And even across our district, I think at the elementary schools, when we looked at the data earlier, at the elementary, we were having more cases, ironically, had more cases at the elementary than we were at the secondary level as the year ended.
So the August 11, 2021 CDC COVID-19 forecasting page predicts a downward trend in Ozaukee County cases over the next 4 weeks. They only extrapolated out to week 36.
Right.
But it is a downward trend in case counts for Ozaukee County. I don't know why they're projecting or forecasting that decrease in case count. I believe that our 53024 numbers, we're doing better than Ozaukee County in the aggregate, substantially better than Ozaukee County in the aggregate. So it wouldn't be unreasonable, at least to interpret from the CDC's own projections, that our numbers in this area would also be decreasing, which would support the reason why we eliminated that mask mandate, I believe, or that was the recommendation. We approved that recommendation for summer school. Part of the reason.
Part of the reason, correct.
Yeah, okay.
Looking at our own data.
So any further discussion? So here's what I'd like to do. To the extent that you have thoughts or ideas, and I'd ask that they be as specific as possible relative to additions, modifications, or deletions to the plan as presented, that I would ask you to articulate those in a motion. Carol will be taking notes to get it as close as possible. And to the extent that the motion garners a second, we'll have discussion on that motion. We'll take a vote, and then we'll move on. So the floor is open.
Okay. Are you making a motion or what?
Yes.
Okay. You want me to go first? Okay. Okay, I'll make a motion to have masks required for all students and staff in the Grafton School District regardless of vaccination status at the start of the 2021-2022 school year until students under 12 are eligible to receive the vaccine, and then we can reevaluate after that point, whatever the time frame is.
Can you repeat the last part?
Sure. I don't know if that last part made sense, but
I have up to at the start of the 21-22
21-22 school year until students under 12 are eligible to receive the vaccine.
You read that back, best you have it.
The motion is to require masks for all students and staff in the Grafton School District, regardless of vaccination status, at the start of the 2021-22 school year until students under 12 are eligible to receive the vaccine.
Is there a second to that motion?
Second.
Any discussion?
I think, last year we learned, we know being in person last year was extremely valuable, and that set us apart. And I think we want to continue that into this school year, and I think the masks weighed heavily in our ability to do that. And so I want to continue that trend. We know it's best for the kids to be in person, to learn in the classroom versus being virtual. We're not offering a virtual option like we did last year. We need the kids in school, and I think that this is the way to do it.
Any further discussion?
Just clarification, so that's K through 12,
Yep,
no matter what your vaccination status is.
correct.
And so if we vote, that's a motion for that.
So I
Then
made the
there's
motion.
no,
He seconded it, and
Right.
then we vote on this, right?
like the criteria of deciding at some point, that would be a separate.
No, you would be going with her, that it would be until all children under 12 have.
Or have eligibility.
But eligibility, what is that day one? That's what I'm saying.
Yeah.
Like, do we need to specify what eligibility?
Let me think. How about, how would that work, Mark?
Well, I mean, the vaccine is not available.
It's not available, so.
Well, but when it becomes
When
available.
it becomes available.
There's still
Right.
6 weeks, but that's from day one. So
Right.
do you go for a
And then-
percentage of?
But parents are not required, even
But
if
they're
it
not even
becomes
required
available,
to
they are
tell
not
us,
required. And
right.
I'm not big on parents being required to state whether or not you chose to do the vaccine.
I'm just asking the question.
right,
Eligible
right.
is not clear, so
Okay,
I'm
so
just
then let's
asking for
not-
clarification.
Okay, so.
I mean, it's probably gonna be a while before the vaccine
Right,
is
so let's-
available, and I think when it becomes available to those under 12, then it's.
Would we
We would
readdress?
revisit.
Yes, that's what I, and
We
readdress
when
after
it's
that.
eligible for those under
Okay.
12. When it's currently eligible for those over 12, and we're going to require a fully vaccinated person with a minuscule chance of getting seriously ill from COVID to wear a mask.
Jerry, I think it's more about the fact that they could, like now we're saying even if we're vaccinated, we could spread
Yes.
it.
Sure. yes.
So that's
that's
kind
it.
of where that, we have siblings, we have, I think that's the reasoning for that.
I know there's a risk. I'm saying it's infinitesimally small.
But that's,
It is. But if there's any, we should do something.
if
I
there's
think,
what?
don't you think?
Well, sure.
I'm
We do it for
struggling with
flu,
asking
we
this
should do it.
I guess it's the older ones who are fully vaccinated, majority, we have 68% of the village of Grafton, and that's including everyone, is vaccinated. And that's
So-
That's 68%
So,
of residents.
residents, but, okay, how about the high school age though? Is that-
Well, our
I don't
problem
do
is
that.
high school age, you're doing
High school
15 to
age is
18.
what, 50?
15 to
15
18.
Well, 12
No, that's 12 to
16 and
17.
17, I have
But
that
there's a
down.
difference. 12 to 17 is not high school. There's not
Right,
12-year-olds in
right.
high school. It's 15.
16 to 17-year-olds, they're 56.1% out of those are vaccinated.
In Grafton?
That's, that was according to, okay, if I broke it down, I'm just gonna say, because I had it calculated, say we have 2,100 students, 50% of the students less than 12 years old, that would be 1,050 ineligible for the vaccine. According to the Department of Health Services, the community vaccination rate showed 64.9% of kids over 12 are vaccinated. Therefore, for our population here, based on the 2,100 students, 369 over the age of 12 probably opted out. So we had 1,449 students that are likely unvaccinated district-wide, which is about the 68% of our total students that are not vaccinated. So our numbers seem to have been broken down less because in the age groups from 12 to 15-year-olds, it showed that 45.4% have completed the series, and 16 to 17-year-olds, 56% completed it. So we probably have more than 1,449 unvaccinated students out of 2,100. Jeff, help me.
I understand your math. I
Right.
don't think that Grafton is a high percentage of the opt-out. Yes, the 12 to 15, there is a higher percentage because my own child is
Right.
only fully vaccinated last month because she just turned 12. So you do have those kids who
Correct.
obviously are turning 12. And I know more parents who are nervous about vaccinating their 12 and 13-year-olds than they were their 17 and 18-year-olds.
Absolutely, but I'm just
16,
saying.
17. So I think more families or more high schoolers chose to vaccinate. It was their choice, and they chose to vaccinate and vaccinated early versus the concern with 12, 13-year-olds. I've just heard many families who have who are very nervous about vaccinating a 12-year-old.
Absolutely.
So I would say in the high school, I do believe there is actually more who
Who were.
were vaccinated. I know quite a, I mean, I obviously I don't know because I cannot ask each, and neither can the school ask each student whether or not they're vaccinated. But
So with that recommendation, so K through 12, whether you're
Right,
vaccinated or
yeah.
not, so, and just looking at, I have a high school son as well, so we're gonna say our high school volleyball team has to play masked against a non-masked high school basketball team, or a volleyball team. So no, because I mean,
How does
you're
that-
making a statement,
Yep.
because the WIA has not come out to make any mandate here. So we're saying our kids, no matter where they are,
I'm saying in school. I didn't,
Well, I think-
with
well,
the sports.
why
no,
I
you
would
don't
don't
we
say a
pick-
kid has to be masked at school, and then as soon as
Okay,
they
well
step
then,
out and
sure.
they're representing Grafton, you don't need to be masked?
No,
And then we would have to look
I'm
at
talking
musicals,
about,
we'd have to look at band, we'd have to look at all of those things that
Well, then we
Well,
would have to
I
look
guess
at
would it be
it.
fair to say you're proposing a
Just what the statement
methodology
is.
consistent with last year?
What did
Say
you
that
ask?
again.
Are you proposing a methodology and practice consistent with last year?
Yes.
So then, yeah.
Mark, would
But
you say?
realize, I mean, last year there was a state mandate that everybody had to wear a mask.
And I think we're heading down the path this year that we're gonna have that. We're gonna have some schools that are, no, not getting down the path of fully mandated, but I think we're heading down the path of some schools are gonna require masks, some aren't.
Correct.
Because, I
And
mean,
so we're gonna have,
do you play Whitefish Bay, do you play Nicolay, do you play Shorewood? I don't know.
So
in the
for
sport.
a
Because they're mask required, those districts. So is that what you mean when you play other
Yeah, I mean,
schools?
I think we're making a statement here, and we have to
Yeah.
understand what's the clarification
Sure.
behind it. Because otherwise, people that are here in administration are hearing one thing,
Sure.
and I think
That's why I'm
that,
asking, the clarity
that's
would be
good.
in a manner consistent with last year's 2020, 2021
Or
practice.
we would let the football team go play without a mask.
That would be a manner,
Right next to.
that would be a manner that would be consistent with the 2020, 2021 2021 practice.
Is that just indoors, or would we just?
I'm saying all of it would be,
Outdoors,
Oh, yeah, what did we say?
But what
outdoors
would,
were different than indoors.
but would the motion
Okay, so
just-
the
yeah.
motion, okay, indoors then, we'll say indoors.
But right, but the volleyball team will be
Yeah.
masked. The school
Indoors.
play will be masked.
Basketball
That's a good
definitely,
question,
yes.
indoors.
Basketball, but basketball as well. You're going
Okay.
into
Right, the high
So-
October, early November.
Okay, so
Wrestling,
mask
The
required
after
indoors.
school, yeah.
yeah, that'd be correct.
So then we'll say
Musicals.
indoors.
Just the way.
a manner consistent with last year.
Which is what we did. If you,
Right.
if the rule was, if we were wearing it during the school day, then you had to wear it in extracurricular activities.
And Joe, you're okay with the
Indoor.
motion being adjusted to that extent?
Yes.
Mark, you're okay with a second?
Yes.
Any further discussion?
I missed what did you ask her if she was okay with?
That her motion would include mask wearing in a manner consistent with the 2020, 2021 school
Which is
year.
basically inside extracurricular.
Right.
Indoors.
Yeah, at
mask.
all times.
I mean, I think that gives administration clarity, should this motion succeed, as to how they would proceed. Any further discussion?
So,
Would through eighth and
Wait.
not the high school be an option?
Well,
Or no?
we're
That's not
working on
your-
this motion
that's
right
not
now.
Oh, okay.
So if we can do it, if it fails, then we would do another motion.
Okay.
Any further discussion?
no, the proposal is to mandate the masking. Are we not giving any guidance on proper masking? Or are we just assuming that our 6-year-olds will do
In a
that?
manner of last year.
Manner of
Yeah, I
last
mean,
year.
Okay, that was last year, it's a
Teachers
new
deal with that
motion
every
though,
day.
so this is a motion for this year. So the whole last year thing is, we're gonna propose a mandate that says you have to wear a mask, but we're not gonna enforce CDC guidelines on how, or offer guidance or teach kids how to wear a mask, follow the guidance on how to wear a mask. We're just gonna say, just put it on because we'll feel better about it, but we're not gonna require per CDC what the CDC says, or we're just picking and choosing what the CDC says.
Yeah,
They list out what should be done with masking, and if we're gonna go down that road, I feel like it would be logical.
I'm not gonna list 10 things that the CDC
It's
is
8 things,
saying.
but,
I'm not gonna be listing,
We didn't do that last
we
year,
didn't do it
Jerry.
last year.
Okay.
We're saying what we
No.
did last year.
we didn't have a vaccine last year, although the vaccine doesn't seem to matter since we're gonna make fully vaccinated adults wear masks.
Actually, the vaccine does matter.
It's a reasonable
The
point.
vaccine does matter, Jerry.
Okay, okay.
I believe it matters.
Is there any further discussion on the motion?
So no, though, is to clarify. We're not gonna,
I would say that that's
As
right.
long as-
No, we're not, there's nothing in this motion that would,
prevent somebody from wearing a cloth
Promulgate.
mask all the
Correct.
time without washing it.
Correct.
Improperly and touching it.
that was in place in the
Makes perfect
2020,
sense.
2021 school year. Okay, any further discussion? All those in favor of the motion, aye.
Aye.
Opposed? Aye.
Aye.
We'll take a roll call. Sean,
Sorry, I got confused.
are you in favor of the motion? Yes or no?
Yes.
Joe,
What?
are you in favor of the
Yes.
motion, yes or no?
Yes.
No.
No,
yes.
no.
No.
the motion fails. Any additional motions for consideration?
I will make another motion Okay. I'll make a motion to make masks required for all students in the middle school and elementary school. All staff and students in Grafton in middle school and elementary school district, regardless of vaccination status, at the start of the 2021-22 school year until students under 12 are eligible to receive the vaccine, and to clarify masking indoors. As like the same as last
manner
year. Same thing,
consistent-
but middle and elementary.
In a manner consistent with the
Correct.
2020.
So the same thing,
2021
but
school
just
year.
minus the high school.
Is there a second?
Second.
Discussion. Any new discussion?
I'm just thinking, I don't know when the vaccine's coming out. I honestly have no idea when the vaccine will be approved for under 12. I'm thinking by the end of the school year, pretty much, yeah, everyone is, or large majority of the kids, not every kid, you're right, but very large majority of the kids by the end of the school year are eligible, just because they all keep getting older. Even your incoming sixth graders are typically 11, turning 12 in their sixth grade year. That is the most typical progression. So therefore, each month, more and more of the sixth graders do become eligible just because of their birth rates.
Yeah, that's a good point.
So by the end of the school year, regardless if there's a vaccine, large majority, because already 2/3 of the school, about 2/3 of the school is eligible for the vaccine. And by the end of the year, it's not, I don't know what percent of the kids are summer birthdays in sixth grade. So, but a higher percentage is definitely eligible then. So we're saying if there's still not a vaccine in May, we're okay with those kids still wearing masks, even though majority, we're now talking probably 75, 85% of the kids are eligible, I would say. Because you already have the 7th and 8th graders are eligible.
I'd like to keep them safe, so yes.
Just one.
The inference is that we don't want to keep them safe. My kids
Well,
go
hold
to
on.
the schools.
I'm
I
not
just
saying
want to
that you're,
clarify.
I'm not saying that you don't want to keep, I'm talking about the decision I'm making for myself. I'm not saying, I know we
Yeah, no,
all
I get
care
it.
about kids.
I'm just clarifying.
I know we all care about kids here, but I'm talking about how we can stay safe or to stay open like we did last year. And just give the parents the opportunity to have their kids vaccinated and protected going into this school year and making them feel comfortable, and making everyone feel comfortable, those who are concerned about it. Not everyone is concerned, clearly, but we need to think about all of our students.
So the motion is for
El-
anybody in middle school, regardless of age.
All staff and students in middle and elementary school, regardless of vaccination status.
So-
And just to be clear, last year we had 157 cases. Was that slide in this deck? 47 of those came from the elementary school and 29 came from the middle school. So in total, 76, but we actually had more at the high school.
I think that's last month's. I can look for that. Give me a second. Carry that. This one's called, what's this one called? 21, 22, about 20, 21 school year plan. That's it.
Last year's. That's the high school.
What's the rationale to not follow the CDC guidelines for proper masking?
What's the rationale for not?
To not make it part of the motion?
I think parents do their best to teach their kids how to wear a mask. I
Or
mean,
the
so should
worst-
we, are you suggesting that we give lessons?
I'm asking if we're making the motion to follow the CDC guidelines on masking.
No, my
why we're
motion,
not-
no, my motion is requiring masks
Right, okay.
for elementary and middle school. Okay?
Why wouldn't, I guess, I'll still ask my question again. Why wouldn't we ensure that whatever we can to ensure that they're
Well,
doing it properly.
I think we could have the district nurse come and educate the families.
And I'm not
We
making
could
the
do-
motion,
that's-
I'm asking.
Right, and I'm responding. Why don't we have that we could have the district nurse come in and educate the elementary school kids and the middle school kids how to properly wear the masks? That's reasonable.
Any further discussion?
What was your question you had, Paul? I'm sorry.
The question, it's a point of clarification.
Yeah.
I mean, this motion is excluding the high school, right? Right, from the
Correct.
mask requirement.
Right.
The body that had the highest incidence of positive cases during the year that we wore masks. Now granted, vaccines are available.
It was the
Correct.
high
We
school.
don't
And they're-
know, pardon?
Right?
Vaccines are available.
Right, and they're eligible for
They're
vaccines,
eligible.
which is.
Okay,
which
I just wanted to.
Something to take into consideration.
Also includes
I'm
staff,
sorry.
which are eligible for the vaccine.
Yeah, we have
These were
5%.
just
Paul,
students.
can you repeat what you just said?
There were
were you saying?
157 total cases last year, right?
Yes, that's correct. 8%
For
of
the
all
whole-
students. We had 47 that were elementary, which is 5%. Middle school had 29, which is 7%. High school had 81, which is 12%.
But the high school is the largest school. I mean,
Correct, out of 700
Right.
students. 720 students last year, I believe,
Mhm.
is what they had. So,
Yeah, and there is another layer of protection with the
Right.
availability of vaccines. I'm just
Correct.
making an
Okay.
observation. I just wanted to make sure that that was the right data.
Okay.
And again, could you read that motion back?
Yes. A motion to require masks indoor in a manner consistent with the 2020-21 school year for all staff and students in middle and elementary school in the 2021-22 year, regardless of vaccination status, until a vaccine is available.
even if the numbers go down, you'd like to still.
That's my
I'm
thought.
open to suggestions on that part.
I'm just
Yeah.
I guess I'm looking particularly at the middle school with
Right.
2/3 eligible at this point, that they're locked in no matter what. Like even if like right now, our numbers go up and I see how we're having to do more things. Even if our numbers go down, if the vaccine hasn't come through, like at the middle school, with 2/3 of the kids eligible for vaccine, and I do believe slowly but surely more kids do get vaccinated. It's very slowly, but some change their minds every day. So whether, on whether or not they want to be vaccinated. So I would say more and more of our 7th and 8th graders, I do believe, would maybe make the choice as time goes on to choose to be vaccinated.
Jeff, do we know the number of 6th graders that are 11?
I would have to see most.
You know the top of your head?
11 or 12?
Yeah.
That they're
Top of your
allowed.
head?
I can get
I would
that
assume
for
most
you.
are 11, just based on you turn.
I could have got that for you, but I didn't.
Didn't anticipate.
Well, I'm just
Another
anticipating
question.
that you have to be 5 to go,
Sorry.
like you have to be 5 to go into kindergarten by September 1st. So I would assume
I like
majority of
that.
the students meet that criteria, that they were 5 by September 1st.
Yeah.
Large
Yeah,
majority
they're
of
going to be.
students.
I mean, so, yeah, but there's gonna be some that are gonna be,
Right, you have.
July, August birthdays who didn't start. I have a son that would be like that, right?
Right, you have some who are older,
Yeah,
I had
some
a
would be
daughter who
older.
skipped a grade, so she would be younger. Like, there's always gonna be that 1 or 2 kids who obviously don't, or who can't get vaccinated, there's gonna be that kid who can't get vaccinated no matter what,
Yep.
regardless of age.
See, that's why I like the 5, 10, 20, because it's clear, like, this is what we do then, this is.
Can you, what is the end of each quarter? In the elementary school, we process on a,
It's quarter. No, we're back.
It is
We're
quarter.
all on quarters now. Yep, so I can get you that. So the calendar would be,
Would you consider
first
just
week in
like
November, I would
6
think, but.
and under?
Or just elementary.
Well, I mean, I do get
No,
the
I would-
6th graders are not eligible.
I would not just do.
That's what I'm saying, including 6th grade.
Instead of the whole middle school.
Right.
First quarter ends on 10/28. Friday, 10/28, the last Friday of October.
But
second quarter,
Mark?
I think the easiest is just unvaccinated. Again, we're trying to split.
Okay.
So then we're gonna add, okay.
Then
yeah,
how
I
do
mean,
you
that's
get that
fine.
information though?
So
Hang on
can
one
we
second, Jeff.
ask
Can-
the
hang on.
vaccine, Jeff?
Excuse me, I've asked a question
I'm sorry,
before we
John.
get into this discussion, but the end of the second quarter is when?
January 21st.
Okay, sorry, and then now.
No, it's okay, I'm sorry, I was like, so,
No, we
Can
got
we-
a motion on the table.
okay.
Any further discussion?
I just have a question, John. Can we ask, Mark was asking a question earlier about, can we ask people if you're not unvaccinated, what were you saying, Mark?
Yeah, we,
Like maybe saying unless you're vaccinated,
So I'm assuming that'd be on someone's honor, right? I mean,
right, and it would, because you
we
can't
wouldn't-
ask for proof, so.
We wouldn't be asking.
So then I'm
the
gonna
district to track
keep it
that.
as vaccinated or unvaccinated, yeah. Okay, it was just, I just wanted to clarify how would that work. if we
Yeah,
did
so
that.
we'll, yeah,
You
so
really couldn't.
Right.
in our scenario, in the different checkpoints,
Yeah.
it would, we had discussion as a team that the principal would talk to the student, just because if you're masked or you're vaccinated, well, we would know if they were masked, because the teacher would have that on their seating
Okay.
chart. But the vaccinated would be, the principal would have to ask the student,
Okay.
and so to say, that would be the piece there, because they could choose to say yes or no.
Okay.
But it wouldn't be a requirement for someone to become vaccinated or a requirement for them to share that with us.
Mhm.
We haven't gone down that path. So it'd be on the honor, is what I'm hearing you say,
Sure, okay.
right? Or,
Right,
I'm
I
asking, I'm not saying.
yeah, I don't
he
think.
was
I'm asking, not saying.
Yeah, I
Right,
don't
he was
think we
just
could
asking, that's why I was
Yeah,
like, I was,
yep.
I was thinking
No.
about if that worked.
Right.
And with no definitive endpoint to this.
The end point would be until
Those under
these
12.
Until those
Individuals
under
are-
12 had the eligibility, at least had the opportunity to be vaccinated.
Just so I'm
So
clear.
once it's
So
approved
then
for the vaccination,
This would go away then.
no, I'd say it would go away, but there would be protection.
Are we anticipating, I'm
And I'm
just asking a
thinking,
question.
go ahead.
I'm just asking a question, are we anticipating that the next round will go all the way down to birth? Or are we anticipating like
No.
five? Because we'll have 4-year-olds. I'm just, I
Well,
don't know what the next
whatever,
roll.
school age children is, I guess, what we're
It's
talking
5
about.
to 12 will be the next.
Right, we're talking
So what are
about,
we doing with our 4 kids?
Right.
right, and that's comes next time.
Well, I'm just, because
Yeah.
if it currently
4K
says
wasn't-
under 12, I'm just asking, do you mean 5 to 12? Or do you mean
We could say-
under 12, meaning, you know,
Is
birth
it-
to, or 6, whatever, I don't know how many, you know.
For right now, the motion is John Long Middle School and elementary.
And elementary, so 4K would be.
Until under 12.
Paul, I'm sorry, we probably should specify, because the statement was just until a vaccine is available.
Right, so we
And
could,
so-
we need to be specific, more
Probably
specific.
need- I mean, right, because right now a vaccine is available.
Oh, for the, under 12,
Right,
yes.
but that's what I'm saying,
Right.
needs to be stated.
Oh, 5 to 12. 5
I'm just
to
asking-
twelve.
Because if you
Yeah.
say
birth, then it's gonna be
No, not birth.
next year.
I would say,
next
I
school
have
year.
no idea.
I mean,
Yeah, there's no.
we don't
It's gonna
have
be
a
a while.
definitive date for 5 to 12.
no.
No, I was just,
But that will be the next group that
Mhm.
gets.
Sure.
So 5 to 12 is the next group that they're looking at to have the
That's what I
vaccine
understand.
approved, from what
I'm
I
not sure.
understand.
So the motion, read the motion back again, please.
Motion to require masks indoors and in a manner consistent with the 2021 school year for all staff and students in middle and elementary school in the 2021-22 year, regardless of vaccination status, until a vaccine is available.
So can we rephrase it to all middle school and elementary school age children?
Yes.
That would include 4-year-olds.
Yes, that would include 4-year-olds.
So by that, would that mean that
Until there's an eligibility for 4-year-olds,
then
that,
it goes away?
correct.
Yeah. So they're eligible.
Would you consider a change to that motion regarding an evaluation at the end of the first quarter based upon assessment of internal statistics and just a reevaluation at the end of the first quarter.
So,
The mandate would, this requirement would be in place for middle school and elementary school
and then reevaluate.
children through the end of the first quarter.
So it wouldn't be
tied
based on
to-
open, when vaccinations
Okay,
are available, just.
So, in other words,
just
go
as-
into it, reevaluate, what, first quarter, when does that end?
October 28th.
I just feel that's too soon. I would look at the second quarter. I'd be okay with looking at it at the second quarter, only
That'd be
because.
January 21st.
Yeah,
January
I would say reevaluate it January 24th, because the vaccine right now is not available, so. I
Yeah,
mean,
it
by the
won't
time, it won't
be available
really,
on
and I want to just get a good start, really, and handle on this, to see. I mean, from what I hear, is the vaccine coming out at the end of fall? That's what I've heard, but I don't know.
They can
for sure. It
bring their
changes.
information September, October, then they have to request an emergency
So
thing, which will take time.
I would consider it for the second quarter, just to
Okay.
reevaluate.
So I'd either ask you to amend your motion, or we can vote on this motion and a new motion brought forward. Your motion.
Okay, I will consider just opening up for reevaluation at the end of the second quarter,
So January 21st.
January 21st. Or
21st.
Or 21st.
At the earlier of the availability of a vaccine, or
whichever, yeah, like say.
January, at the end of the second quarter.
We're probably looking at that time,
Right,
at the
that's why I
earliest
was like,
anyway, by the
right.
time like,
Once it gets started, approved,
And
and
then you
then.
have that
You have the
time
time frame, the 7, 8 weeks, or however long it takes, so.
7 or 8 weeks.
I'm just trying to think of the timing, once you get the
When you
vaccine.
get the first dose.
First dose.
That's not what the first motion was predicated on, the availability of the
Right.
vaccine, not the implementation of the vaccine. So I
Correct.
want to be
So-
clear, I want to be
right. No, we're
specific.
just-
No, yeah.
Is it,
I'm just talking, because you said.
well, I asked you if you'd be interested in amending your motion. If not, then I'm going to call, if there's no further discussion, I'll call for a motion on your, a vote on your amendment. Any further discussion?
Yes, I am amending it.
Pardon?
To the reevaluate January 24th.
The earlier of the availability of a vaccine,
I'm just trying to think,
or the end of the second quarter, which is January 21st. So, but if the vaccine becomes available
okay,
in
say the vaccine.
December 1st,
Okay,
we would reevaluate it at the December meeting.
okay,
We would reevaluate it based upon case statistics at that time, our own data, with the understanding and the knowledge that there's a vaccine that's been approved and on the horizon.
We're
Yeah.
still going to require 7th and 8th graders to wear masks, even
well,
if they're
we're
fully
going to
vaccinated.
be reevaluating, I'm going to amend
Right,
it.
until then, we're still going to require 7th
Correct.
and 8th graders, if this motion passes, to wear masks even if they're fully vaccinated.
Until we
But then
reevaluate
once 6th
January.
graders are eligible, most 6th graders are eligible for a vaccine, then we'll reevaluate, or then we'll
No, we'll
remove?
No, we
reevaluate
will
when the vaccine is
reevaluate.
available, or
Or by this.
in our January meeting, which I
Correct.
assume is after the 21st,
Yeah,
since we meet on the 4th.
Yes.
yeah,
So if you're 13
Oh,
and you're
that's
fully
what you're saying,
vaccinated,
January 24th, yeah.
you're subjected to the same mandate as an 11-year-old unvaccinated,
yes.
Through the end of the second quarter minimum.
Second quarter,
based on how we feel about it. That's what we're saying.
Well,
Based on
well,
what?
based-
Reevaluate based on how we feel, not on
We just,
science or data, just
Well, it would be, I would propose that we evaluate it based upon
Internal
the
data?
caseload trends, our own data that we experience at the startup at these grade levels. We would look at all of those data elements. So it'd be beyond feeling. I personally, Jerry, I think a lot of this is about feeling.
clearly.
I mean, masks, yes, I believe that masks are a reasonable mitigating element, but masks worn inappropriately diminish the effectiveness of those. I mean, a cloth mask, I've read studies that say they're maybe 25% effective. If they're worn inappropriately, dirty, all the things, they might be 10% effective. They provide some level of mitigation, marginal, so clearly the benefit is relative to how we feel about it. The largest benefit is relative to how we feel about it.
Especially because we're not, again, we're not even suggesting to follow CDC guidelines on how to wear the mask.
I agree. I
guess I
agree.
would just have liked to see it, like, that we're looking at it sooner rather than, because the vaccine is a long way off, and January seems like a long way off. So despite our data, we're not reevaluating until that point. It just seems like a long way off to reevaluate no matter what our data is. That's all. For me. I'm a data-driven person. I like our internal data. I like what's happening with our students. That's what I care most about, is what it looks like in our school with our students. So I do want to keep everyone safe, and I do care about kids, but what I need to be most concerned about is the kids in our building. What other schools are doing matters less to me. What other people in Ozaki are doing matters less to me. It's what's happening in our own schools. And if the numbers show that, you know, what is really decreasing in the 7th and 8th grade, and it shows that September, October, nope, you're still wearing a mask, you have no choice. You're going to be out there playing volleyball, basketball, you have no choice. You're going to be doing it despite what our numbers say, because the community, and I get that, and we're saying we're keeping everyone safe, but then we're not looking at our data, we're looking at everyone else's data. I'm looking at our kids, and I understand that they can go home and they can spread it. I also know that those kids can take off their masks the second they walk out the door from our schools and spread it. And that at the high school, we were often thinking that's where it was coming from. We have high cases, and it was from kids making a choice after school on what they were doing, whether they congregated in the parking lot, after, you know, in the supermarket, and everywhere else. And I thought that's why it was higher at the high school. They were making a choice.
It's a compelling argument. Okay, have you agreed to amend
I agree to amend it to,
earlier of
right,
availability of vaccination
correct.
or the second quarter, end of the second quarter?
I would say.
Mark, are you amenable to amending?
Yeah.
Or Sean, are you amenable to
You seconding that?
amending that, seconding that amended motion? Any further discussion? All those in favor of the motion, aye.
Aye.
Opposed? Aye. We'll take a voice. Sean?
No, I'm so confused. What did you just do? Why did I hear 2 ayes?
We're taking a voice vote to learn that. So are you in favor of the motion?
You seconded it.
I seconded the motion, yes.
So you voted yes.
You vote.
But I actually want to vote now.
Okay.
Can I vote now?
You can vote no,
Okay.
absolutely. Joe?
Yes.
No.
No.
Yes.
No. No.
The motion fails.
Oh, I'm sorry, I need to. Carrie was no, Paul was no, Mark was yes.
Yes.
Thank you.
Any additional recommendations?
I'd like to make a motion
Okay.
that all unvaccinated students, staff, and visitors be required to wear masks indoors consistent with last year until they are fully vaccinated during the 2021-2022 school year.
Could you repeat that one more time?
All unvaccinated students, staff, and visitors be required to wear masks indoors consistent with last year until fully vaccinated during the 2021-2022 school year.
Is there a second? Any second?
Should we repeat it one more time? I'm sorry.
All unvaccinated students, staff, and visitors be required to wear masks indoors, consistent with last year's school year, until they are fully vaccinated during the 2021-2022 school year.
Give a second to that motion.
I guess that would require.
If you want to move this to discussion,
Oh,
then I
then
would
you
just
have to
suggest
second?
that you second the motion and allow us to put it on the table and
Okay.
move to discussion. No, you don't want a second? Right. In the absence of a second, the motion has failed. Any additional?
Okay.
I will make a motion to implement for the elementary schools. Can you go back to the elementary one, Jeff? The 5%. Yes. I'll make a motion for elementary and John Long, that for building-wide, masks are worn while entering and leaving the building during transition times. As you have listed there, I would ask for us to identify the et cetera, just so that we would have clarification. But basically through the passing time, so on your way into the building, on your way to your class, as you transition out of your class, as you leave to lunch, that you would be wearing a mask at those times
So when moving,
when you're moving outside your class.
just clarifying.
And that would give the teachers the ability then for, to create the social distancing inside their class and those things. But while you're outside your class, in and out of the building to lunch, you'd be wearing a mask in passing periods.
For permanent, for,
Point.
We have a motion. Do you have that motion recorded?
clarify his motion.
Ah, okay.
And to add something, I would do the same thing I would do through the first semester or a vaccine being available, whichever one comes first, to be evaluated.
Is there a second to that motion?
Second.
Motion has been made and seconded. Kara, can you read the motion back?
Motion to implement for the elementary schools and JLMS building-wide mask wearing during the times noted in the 5% positivity rate guidelines through the first semester or with the availability of the vaccine, whichever comes first.
Any discussion? Yes.
Can I ask a clarifying question?
Yes.
Are you saying adults will wear face, are you doing all these bullets, or are you just doing that second?
The second bullet, just the
I
second
think
bullet.
I think she has to edit that's why I want to make sure that it's accurate what you're asking for. So I think you're saying.
Like starting, right? Not at 5%.
And not at
And
five.
you're saying all, so that's staff and students in 4K through 8th grade? Or are you saying students only?
I was going to just say students. You were.
You are.
Yes, I was referring to just the students.
Okay. Thank you.
So I'm thinking like,
So maybe have her repeat
And then
that.
for clarity,
Okay.
and I would ask administration to clarify that, that there's not an et cetera at the end, that it's the clear bullet points of what those are.
For modeling, and we're at discussion, right? For modeling behavior purposes, would it make sense for staff to also wear those masks?
like in walk, if they're walking.
Right.
If they're
Yeah,
walking with
for
their kids,
sure.
yes, I can amend mine and say students and staff. While they're
Can I
moving.
ask a question or do I have to
Yes.
wait? I didn't know if she had to read it
I'm
back.
sorry, Steve
Yes,
amended it, so I need a second on the amendment.
second. Thank you.
Discussion, can you read
I can
the
ask that.
amended
No,
motion?
she wants to read it.
Or change it again. More good.
This has been reading for me to learn the process.
Motion to implement for the elementary schools and John Long Middle School, building-wide mask wearing by staff and students during the times noted in the 5% positivity rate guidelines listed at the second bullet through the first semester or with availability of a vaccine, whichever comes first.
Okay, so what I'm wondering is just thinking as a teacher, especially the younger you get, 4K, kindergarten, first grade, if these little kids are taking the masks off in the classroom, is this what? But then they have to put them on when they're walking.
Classroom.
So I just envision kids like, where are they putting them? And then are they getting dirty? Are they falling on the floor? Are they
So I guess
getting lost?
So for clarification, I mean, this is an administration recommendations. I mean, what was your discussion point around that? As far as how you would handle that if we got to the 5%?
Yeah, we work with the students, so students, when they went outside for recess, would typically not have their masks on outside at recess, so they.
Would they just like put them in their pocket?
Or they'd have the lanyard, or
like a
they'd have
thing.
the hanging thing, or all those pieces, so that they wouldn't, so it wouldn't go on the ground or anything else. And masks would get lost at the elementary school, which is why we had multiple things at the elementary school as well. Or if something did get dirty, someone sneezed into their mask, then they would maybe want a new one. So they'd come to the office, and we had disposable masks that they would wear and take with them. So that's how I'd work with our elementary principals and Mr. Gearing to finalize that, but that's what we did last year. Talking about being consistent with last year. Just didn't necessarily happen in a classroom, but did happen at other times. I'm sorry.
Can I just ask a question? So with this proposal, so we're saying no masks in the classroom, just when you're walking?
Correct.
So, but last year, we were social distance, weren't we at 6 feet or no?
We were social distance to the maximum. We still weren't 6 feet. We still weren't able to
Right,
be
so
6
it was
feet.
between
So,
3 and 6
yes.
or whatever?
Yep. So you still had students that were in small cohorts, so whether there were 2 or 4, students together in a pod, but you weren't able to get everyone 6 feet away. And that's where that
Right,
3 feet
okay.
piece came from with this, because that was the discussion too, is there's even disagreement on should it be 3 feet, should it be 6 feet, what is the close contact?
Okay, so.
But we
in
used
other-
6 feet last year, I'm sorry to interrupt you,
Right.
but
No,
we did
that's
use
okay,
6
I'm
feet.
just-
Yeah, I know, yeah, so that's what we did last year.
And this year, our classroom setting for the elementary grades is more like it was in the
Right.
1920 school year.
Yes.
Like yeah.
So the kids are gonna be really, definitely not,
Well, they're still gonna be in pods, right? I mean, so
Right.
you're still gonna, so yeah, you're gonna have students in that, but you may have a mixing of pods, which is why we talked about at a checkpoint, and then we'd stop
Right,
doing
yeah.
that. So you wouldn't have those pods mixing, because you're always gonna have students that are working together on something, and so you can limit that. And so you talked, like Paul said earlier, could we encourage social distancing? Could we do other things? Definitely, we could. I mean, those are things that we could try and maximize our spaces, but you're never going to be in a situation where someone isn't in close contact with someone. Our classrooms just aren't big enough.
Any further discussion?
What's the rationale behind having them wear masks when they're moving? What's the CDC guidelines on how long you have to be within close proximity to someone?
15 minutes
15 minutes.
over a
But is that
24-hour
still-
period.
Have they maintained that, or did that change?
To the best of my knowledge, that is still maintained.
Because I thought that changed.
I don't believe
I don't believe
There's
that it's
discussions about it
changed.
changing. I think you have the WHO and you have, CDC, there's different parameters around that, but
We still follow it at work, the same guideline.
And
What's
what's
that?
changed is
I
there's
believe
it's
vaccination.
15.
What's changed is there's a vaccine.
Correct.
I mean, that's where you saw some of the things that we talked about, is like, some of the things that we talked about as clarifying points were because there is a vaccine that goes with it,
Well, yeah, except at the elementary.
except for K through 6.
Any further discussion?
I appreciate that, but I don't see how that's helping with kids who are unvaccinated at that age. I mean,
Well, if we,
I'm going to agree with Joe for once tonight, that I don't think that's, I mean, yeah. I guess I would agree.
Okay. Any further discussion? Hearing none, all those in favor of the motion, aye. Aye. Opposed?
I
Aye.
And we'll take a voice vote. Sean, how do you vote?
no.
no.
Joe?
Yes.
Yes,
Yes.
Yes.
No.
and the motion passes. Any additional recommendations regarding additions, modifications, or deletions to the plan as presented?
So currently,
So
there
what
would
is-
not be masking required except for passing times. That's what just passed, right?
So-
Or 10% positivity, right? A 10% positivity.
Well, with 5%, you would still have the other mitigation factors.
At this point, the 5% factor still remains as
Oh,
presented.
no, but I'm just
Point two's
in,
gone.
Yeah,
in relation to it's the 10% is when masking would be required or mandated, right?
Unless the board were to make
Change
a
that.
different modification.
What do you mean? To this plan or to?
The other 5, 10, and 20% are staying, unless we do
that's
something more
correct.
as is.
As I said, we will,
Are required.
once we're done adding, deleting, or amending, I will ask for a motion on the plan as presented, subject to motions that have passed as part of this discussion.
So we can make more motions?
You
Yes.
can make more motions, but
Like,
the hour is getting late.
What about,
and
like, can I make another motion?
You absolutely
As
can.
far as
Yes, you absolutely
requiring
can.
masks?
Yes,
Or I could, I could, okay.
yes.
All right, I'll make another motion. I would like to make a motion to require masks for all students in 6th grade and under, indoors for staff and students. And reevaluate January 24th. 21st,
Well, the
sorry,
meeting's
thank you.
Yeah.
January
you would-
21st,
the
to
24th would be the meeting.
24th,
I'm
okay.
sorry, yep, the 24th would be
So
the
to be
meeting.
reevaluated on the 24th, so, Kara, did you get that? Okay, motion to make,
Motion to require masks for all staff and students in 6th grade and under indoors to be reevaluated on January 24th.
correct.
So it's essentially the same as the second
Right, the
motion,
first and second, except,
but it's cut off at 6th grade.
correct. Because students are, yeah.
Second.
Any discussion? Hearing none, all those in favor of the motion, aye.
Aye.
Opposed? Aye. Take a voice vote.
No.
Yes,
No.
No.
Yes.
No.
No.
Motion fails.
okay. I have one more motion. Okay, elementary, okay. I have another. I'm not gonna say, okay. I have a, thank you. I would like to make, okay, thank you. I'd like to make a motion for elementary schools, masks to be required for all students and staff in the Grafton School District, regardless of vaccination status, at the start of the 21-22 school year, and to be reevaluated January 24th.
To be evaluated, say that again, Jim?
Oh, sorry.
The end of the second quarter?
To be evaluated at the end of the second quarter.
Is there a second?
Okay, first quarter, I'll go with first.
At the end of the first quarter?
Correct.
Is there a second?
Second.
Is there any further discussion?
I don't get, why the first quarter and not the second quarter?
Because then we would
Then you
have,
could talk about, what, go ahead.
I would feel like then we have more internal data. We would
Then
have
we
2
would
months of
talk about it
internal data.
again, so that way.
Okay, what
So
kind
then
of
it's- we're not
internal
saying-
data would
we
change
have-
anything?
Are the cases going up, or the cases going down, or if the cases are staying the same, do we see a
And then aren't they gonna
difference
say then masks are working? Like, it just doesn't make sense to me.
It's not,
If you say the first quarter, I'm just trying to understand why that rationale of the first quarter.
Because the kids will have been in school 2 months, and we'll have some idea how the kids are doing.
But they're
If we think-
masking.
I understand that they're masking at that point. However, we would have middle school and high schoolers not masking. Can we compare? Can we see? Can we see what the community spread is? Can we see how many cases we've had? If we have, whatever the data is, we will have data. It's not that it has to change at first semester, like at first quarter, just because we're talking
just
about
gonna
it does
talk
not
about it.
change anything.
I
It just means we
there was
talked
a
about
lot
it.
of
Right, no.
feeling on that, and before, no one had anything to say, so I was
Sure.
just curious
No,
why.
that was a really good
I think we
clarification.
saw,
Thank you.
we saw last year that the schools didn't spread it, right? And so if they're wearing masks in school and then they're outside of school and then cases go up, it's not because of the schools, right? And so I think then you can glean some information out of that.
Okay.
Okay, so.
any further discussion? Carrie, can you read the motion? Can you,
Motion to require masks for all students and staff in the elementary schools at the start of the 21-22 school year, regardless of vaccination status, to be reevaluated at the end of the first quarter.
Which is October.
October 28th?
When's our meeting that month, Jeff, out of curiosity?
Because do we want
That's
to,
okay.
the meeting, I
So we're
think, is
still in the
before
point
the
of
end
discussion.
Let me find that for you.
October, yeah, so October 20, I think our meeting is before.
Yeah, our meeting would be the 25th. Our meeting would be on the 25th. It's the fourth Monday,
Are you
the 25th.
comfortable amending it to the 25th? So we would discuss it at the October board meeting
Yeah.
versus the November board meeting?
Otherwise, it'd be November 22nd.
I'm just-
What is that the end of the first?
The first quarter is October 28th, our
Okay.
meeting is October 24th.
It's a short week.
Yeah.
It ends on, the weekend's on Thursday because it's parent-teacher conferences on Friday.
Okay,
So
we
it
all,
ends short.
I can remember to the 25th, so we can bring it up for discussion again.
Any further
I'm
discussion?
sorry, Mark needs to.
Oh, so yes.
Second, the amendment.
Any further discussion? All right, all those in favor of the motion, aye. Aye. Opposed?
Opposed.
Take a voice vote. Sean?
Yes.
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 No.
The motion passes. Any additional amendments? I'd like to, any additional? I would like to offer, and I don't know, if in the page, face coverings approved on 7/26. After face coverings are optional indoors and outdoors for students, staff, and visitors. offer language, all students, staff, parents, volunteers, other district stakeholders who may have a concern of any sorts regarding the optional mask policy are strongly encouraged to wear a mask at any time or at all times.
Are you asking?
I'm making a motion that that be added to the language.
Can you clarify what you were saying?
Face coverings are optional indoors and outdoors for students, staff, and visitors.
Which page?
One, two, starts with face coverings approved. Right. Yes. So just at the end of that, all students, staff, parents, volunteers, other district stakeholders who may have a concern of any sorts regarding the optional mask policy are strongly encouraged to wear a mask at any time or at all times. So if you have a concern with this policy that reflects optional, then please, we encourage you to wear a mask for whatever reason.
I'm not sure what you're asking or.
I'm
wanting
asking
amend.
to add language at the end of that sentence.
So I'm asking Paul, the
Yeah.
president, thank you.
Yes.
Can I hear your response?
That's right,
Okay.
that's what I'm
All right.
proposing to
You're
add that
asking for a second.
language, and
Yeah.
I'm looking for a
Okay.
second.
But I'm hearing lots of voices and I just want to hear yours.
Yeah, okay. That's what I'm asking, to add that language.
Which language?
All students, staff, parents, volunteers, other district stakeholders who may have a concern of any sorts regarding the optional mask policy are strongly encouraged to wear a mask at any time or at all times.
Second.
You feel it's necessary? Like, I mean, I feel like people are gonna wear masks, but you would.
At any time or at all?
I feel it's necessary that we go on record that
But that sounds
And-
like
and-
two different things to me, at any time or at all time.
then at any time, strike, or at all times, at any time.
That you're in the building?
Anytime, anytime on district grounds. If you have a concern relative to an optional policy, then you should wear a mask, is what I'm saying our policy should read.
Okay.
Face coverings are optional.
So do we need to?
But they're not anymore
when-
because they're
because
not
of-
optional
in the
indoors at
element-
the elementary schools.
Our policy is, all other buildings, they are optional.
Middle school and high school, they are optional
All visitors, staff, they're optional,
in this plan.
right?
Yep.
And I'm saying we should go on record to say, if you have a concern with an optional policy, then you should wear a mask. And our policy should be affirmative in that regard. And from my perspective, then we get to highlight in the mitigation strategy, face masks. Because our policy does recommend face masks. When you have a concern, face masks are recommended.
Okay.
That's the language that I'm proposing. You seconded that?
No, Mark said.
Mark did?
And I said-
But it would be required at the elementary schools.
Yes.
Okay, yes, okay, now,
Yes.
so,
I'm not changing that at all.
Okay.
All I'm doing
I
is
was-
adding clarifying
But I
language
think
to
that
it.
needs to be clarified, doesn't it?
No, it's in there.
Because
We
it's
just
all
approved it.
staff and students, but I don't think it addresses like visitors, does it?
At the elementary school?
At the
Yeah.
elementary school, it does.
Oh, it does?
Well, that would, visitors will be
that-
required to wear masks.
so,
We would edit this page.
oh,
Yes.
okay.
So we
Well,
would
but
edit this
the
page to share
motion-
with all parents. So whatever changes the board makes, modifications, additions, deletions, we will modify our presentation that we had and share that with all staff and all parents, hopefully tomorrow. It
Well,
won't be
so
early,
maybe I'm
because
not
we're welcome back, but
being
we'll
clear
edit
on my confusion.
Okay.
Yeah.
So we just made a change, but what I remember hearing, and maybe that's what you need to clarify for me, is it included staff and students. Did it include visitors for elementary school?
No.
So that's what I'm saying. We need to clarify that. Like if a visitor comes to the elementary school, there needs to be language saying they should wear a mask. If everyone else in the building has to wear a mask. Do you know what I mean?
Would that not be in a manner consistent with 2020, 2021?
It would be. In all honesty, then we wouldn't have visitors. Because we didn't allow visitors in 2020, 2021 until later in the year because we did limit.
Oh, okay, so the
Like
language
we
is,
started
we're
the year and
consistent.
allowed, like the one exception we made was first day of school. We allowed visitors in they wear masks, and then they left, and then we really limited visitors throughout the year till later in the spring. We started doing optional pieces.
So elementary schools will function as 2021.
But that includes
For the first semester.
cohorting, so like that language isn't
So hang
clear
on,
then.
hang on.
He's saying face coverings is what he's saying,
Yeah, can-
as I understand.
Right, so
Oh.
I think we should go back, I mean, and if we have a second,
Yes.
is there any further discussion regarding that language? Because I think we should go back and clarify our intent for elementary school relative to visitors. I think we need to do that. Because I think it's administration's recommendation to rely on volunteers and visitors.
Yes, so we would.
Okay, so we have this motion regarding the language that I'm proposing to add. Any further discussion? Hearing none, all those in favor of the motion, aye.
Aye.
Opposed?
Opposed.
You have the let's take a voice vote, Sean?
Yes.
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 No.
Okay. Now I think we need to clarify the elementary school. I believe we need to. I mean,
Yeah.
it'd be a
Sure.
question that I have for
Well, we
administration.
should allow visitors.
Right, so then we would just add,
Do I need to make a motion to allow visitors and
Volunteers.
volunteers?
Volunteers.
I'd like to make a motion to allow visitors and volunteers at the elementary schools, starting day one,
And they wear.
and they will wear masks until we reevaluate on the October board meeting.
Second.
So we get a motion and a second. Any discussion? Hearing none, all those in favor of the motion, aye. Aye. Opposed? Take a voice vote, Sean?
Yes.
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 Yes,
Yes.
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 and the motion passes. Any further additions, amendments, modifications, or deletions? I'm sorry, I'm sorry,
How do you have data to start the year? You know nothing about what level
any further recommendations?
You've defined how.
Any further recommendations, modifications, or amendments? Hearing none, then I'd entertain a motion to approve the administrative recommendation as presented, subject to, Kara, it is 3 or 4 modifications? 4. Four. So I would entertain a motion to adopt the administrative recommendation as presented this evening, subject to the 4 amendments that have been approved by virtual vote.
Second.
Do we have a motion?
Or motion. So moved.
Do we have a second?
Second.
Any further discussion? Again, we are looking to approve the administrative recommendation as presented, subject to the 4 amendments, modifications, additions, or deletions that were previously approved. Hearing none, all those in favor of the motion, aye. Aye. Opposed?
Aye.
We'll take a voice vote. Sean?
Oh, yes.
Yes. Yes.
Yes.
Yes.
Yes.
No.
And the motion passes. All right, thank you, Jeff. And thank the entire administration team for all of the work that they put in getting us to this point. It's only the starting point. In 2 weeks, the real work continues. I'm going to ask that before we move on, we suspend the meeting for a bio break.
Yeah, thank you.
And we'll be back in 5 minutes.
Yeah,
I need the bathroom.
to item D on the agenda, 2021-2022 COVID-19 Staff Handbook Addendum.
Let's hope.
So, as you recall, last year we had a COVID-19 handbook addendum for staff. Last year, approved in August. A lot of things changed with that handbook through the course of the year. We're bringing back essentially a new edition for this year and incorporating some of those changes into the handbook. So I'll briefly go through some of the changes that would make it different from last year's handbook addendum. Obviously, we're not referencing the previous year's reopening plan. And the last year's referenced specific safety materials that teachers could request. They could still request safety materials, we just don't list them specifically. Moving on into section 1, close contacts refers to household close contacts, as we aren't close contacting unless we move into the 5-10-20. We also removed listing specific symptoms in the document, but rather have a link to a health checklist that would list those symptoms that staff have to be concerned about. We also removed references to mask requirements and social distancing. I would point out, though, that we would need to add language saying that masks are optional, basically unless required at their grade level. So for example, at the elementary school, staff would be required to wear masks. They would be required of staff at other levels if that positivity slash and quarantine rate reached one of those levels that required masks. So that would need to be added on as a bullet point under daily entry and reporting requirements. For quarantine guidelines, close contacts no longer are needed to quarantine unless they're household contact. And again, unless those positivity or quarantine rates change. The guidelines are different than what we started with last year. It was the 14 days for quarantining. We moved during the year to 10 days. We're starting this year with the handbook stating the shorter quarantine period, as well as having post-vaccination guidelines added. Obviously, we didn't have a vaccine at the beginning of last year when we adopted the original handbook. The additional leaves, section 3, hasn't really changed except that they're no longer CARES Act leaves, but ARPA leaves, and they would end September 30th of 2021. No real changes to section 4, 5, or 6. And then section 7, last year we had a notification of travel that became somewhat moot as when people traveled, they weren't traveling to a place that was necessarily any worse off than we were. So we have removed that section. With that, are there any questions or comments on this document?
So for everybody else, I'll have to add that at the middle school, they're gonna have to wear masks when moving.
Correct, teachers. So unless, yeah.
No, I don't think, I'm not to counteract you, but I wonder about saying something along the lines of whatever board approved plan. So if this changes in October, we don't bring an addendum back. If something changes because of a vaccine, if something changes because of blank, if we could just use that language.
Similar to what we did last year, because last year we didn't bring this back when the quarantine period went from 14 days to 10 days.
Yeah, because that's what, some of those pieces, yeah. So if we could do that, if the board would be okay with that, because then that gives, because it helps us too not have to remember to change that.
But definitely adding, I think that mask bullet.
Yeah, 100% correct. Yep, agreed.
On the first page, at the end of the first paragraph, there's a sentence that begins with "moving forward." Do we actually do that?
Page 1?
Yes.
Yeah. The first paragraph.
Moving forward, we will work with do we work with the Washington-Ozaukee Health Department?
We do. We discussed that concept that we still will get notification of positive cases,
Okay.
even if they aren't reported directly to us by the family. So there is there's certainly still some cooperation and contact and communication going back
Okay.
and forth.
I just didn't know if that continued.
They have said that it will be better this year, that they've hired additional staff, because at one point it was non-existent for us. We were using our own internal people to do this, because we couldn't wait, because it would have spread.
Okay.
But we do work with them. Bless you.
Any additional questions? Hearing none, then I'd entertain a motion to approve the 2021-22 COVID-19 Handbook Addendum as discussed, to be modified subject to the changes in the 2021-22 school year plan.
So moved.
I'm sorry, who was that?
So moved.
All those in favor of the motion, aye. Aye. Opposed, and it passes. Personnel report.
Yes, we'd ask for approval from the board for our new hires and our resignations and a change in position. We have Marie Arthur, a third grade teacher at Woodview Elementary School, and Brandy Becker, kindergarten teacher at Kennedy Elementary School. We would ask, this is pending the release from their former district this week, so those two are pending. But then Laura Borner, ELA teacher at John Long Middle School, Will Hall, social studies teacher at Grafton High School, Nicole Latow, science teacher at John Long Middle School, and Michael Seafeld, special education teacher at Grafton High School. And then approve the resignations of Tim Manley, kindergarten teacher at Kennedy Elementary School, and Elizabeth Minty, career and college instructional specialist. And we have a change in position of Kayla Meyer from third grade teacher to instructional coach at Woodview Elementary School. And then informational only, we have new hires. We have Amy Janata, special education aide at Kennedy, Amy Kneppel, library media aide at Woodview, resignations of Amy Hagenow, kindergarten aide at Woodview, and Maria Pupak, library aide at Woodview Elementary School. And change in positions from current staff from Marcy Hertz from special education aide to office assistant at Woodview Elementary School, April Herman from 4K aide to office assistant at Woodview Elementary School, and Roberta Ladd, special education aide from Woodview Elementary to John Long Middle School.
So we'll take these in pieces. First, I'd entertain a motion to approve the new hires as presented.
I'm sorry,
Oh.
we need to take the first two
First two
separately,
separate.
because that would be pending release from their former district.
Sorry, missed that. Okay, so a motion to approve the hiring of Marie Arthur and Brandy Becker as presented.
So moved.
Second.
Any discussion? All those in favor of the motion, aye. Aye. Opposed? And it passes. Now a motion to approve the remaining four hires, Laura Borner, Will Hall, Nicole Latow, and Michael Seafeld.
So moved.
Second.
Any discussion? All those in favor of the motion, aye. Aye. Opposed? And that passes. Entertain a motion to approve the resignations of Tim Manley and Elizabeth Minty.
So moved.
Second.
Is there any discussion?
I'm sorry.
Oh, so
Mark
moved.
and,
Steve and then.
Oh,
just give it to one of them.
either one.
Any discussion? Hearing none, all those in favor of the motion, aye. Aye. Opposed? And it passes. Last but not least, the change of position for Kayla Meyer from third grade teacher to instructional coach at Woodview Elementary School. Motion. Joe moved, second.
Yes.
Second.
Any discussion? All those in favor of the motion, aye. Aye. Opposed? And those personnel placements and changes have been approved. Item F, 2020-21 year-end budget report.
That would be me, bringing that up. So this is sort of a shorter version of the treasurer's report that will occur at the annual meeting in September. So I bring this forward just to kind of review the finances, which are still, going through the audit process for how we ended the 2020-21 school year. So taking a look at our expenditures, I've highlighted in green some of the areas that finished better than budgeted, and then the yellow areas which we spent more than had been budgeted. I'll point out that the employee benefits in Fund 10 and the employee benefits in Fund 27 sort of interact in that we had budgeted retirement benefits all into Fund 10, including some of the expenditures that were related to special ed retirees. At the end of the year, we did move those related to special ed retirees into Fund 27, which is why Fund 27 comes in higher than budgeted, but Fund 10 comes in lower than budgeted. For purchase services in Fund 10, as pointed out in my notes, and is also going to be true for purchase services in Fund 27, came in better than budgeted, primarily because of transportation and subbing expenditures coming in well below budgeted. In Fund 10 for insurance and judgments, that going over budget is related to the unemployment benefits, obviously related to the COVID-19 and layoffs and such. And then we have obviously the operating transfers out. So you see a lot of areas where we came in under budget. That operating transfer out is related to having no budget for a fund transfer to Fund 46. We budgeted $0. We ended up transferring over $737,000 into Fund 46, which is why that area is, obviously we shifted a lot of our underperforming areas into that category. And then finally, for non-capital objects, that typically happens for our flow-through budget. We budget for the potential for some large expenditures that might be necessary if we get certain students who come in to the district, but often then we don't need those items and we come in under budget for those non-capital objects in Fund 27. For revenue, we have a federal revenue that came in well over budget. That's primarily because of Medicaid. So it's prior year Medicaid adjustments, which we don't budget for because they don't necessarily, we can't count on them coming in. We had about $100,000 come in prior year Medicaid adjustments in Fund 10, as well as ESSER 2 funds, $186,000 of ESSER 2 funds that came in that of course we didn't budget for because ESSER 2 didn't exist when we passed this budget in October. Then we have revenues coming in below budget at the state level. That is basically a result of the fact that the biennial budget said we would get reimbursed at 30% of the prior year expenditures, but there wasn't enough money actually budgeted to cover 30%, so it was prorated to 28%. So we came in, our revenue in Fund 27 came in low at the state level, and it also came in low at the federal level. That's primarily due to, again, flow-through revenue that wasn't spent, that was budgeted. Obviously, if we don't spend what we had budgeted, then we don't claim that revenue to come in through flow-through. I also put together, because of course we had carved COVID out of this so that we could have comparisons at our quarterly reports. We had the COVID budget of about $777,000 for this year. It came in at $768,000. And in a more friendly piece, this is what those expenditures look like. Obviously, these categories can be in different categories based on that previous slide, but this is what we recall talking about as we moved through the summer of 2020 and into the beginning of the school year. Those budgeted areas, the health aides, instructional technology, dedicated building subs, the one-time expenditure for air handling upgrades and flexible furniture, as well as the mitigation strategies, which included masks and the plexiglass, the signage, asking people to socially distance, as well as trailers to house some of the furniture that wasn't very conducive to social distancing. And so those were the final totals for our COVID-19 expenditures this past year. Where we end up with potential adjustments with the auditor coming in, but they would be minor ones. Where we end up is with a fund balance trend That increased by about $300,000 from 4.61 million to 4.91 million. That is a ending year fund balance ratio of 19.8%, which is above our board mandated ratio of 15%. Any questions?
Do you recall, Topher, what was projected that our ending revenue would be at? I mean, we weren't planning on the growth.
We had a balanced budget, so we were projecting that we would end at 4.61. Now, obviously, leading up to that October meeting in the summer, we were projecting the possibility of having to spend down fund balance. But then we had favorable results from open enrollment and some other pieces that helped us get to a balanced budget for that October meeting.
Good.
Just a clarification on page 3, the state shortfall there, it had previously been asserted that this is a district matter, but you're saying this is issues related to state budgets and allocations to the district versus a district budgeted matter that cost the district aid otherwise available for special education.
That is correct. So the last biennial budget, the state had put enough money to what was estimated to cover 26% in the first year of the biennial and 30% in the second year of the biennial. First year of the biennial was short of that 26%, and then that second year, there wasn't enough in the state budget to cover all of the state's costs at 30%. So they have to prorate that because it's some certain, and they prorated that down to the 28%. Now, what they're saying in this next biennial is that this first year will cover 28%, and the second year will cover 30%. We'll monitor that, because obviously there would be concerns that maybe not our district so much, but especially districts around the state may see an uptick in special ed costs due to learning loss with not being in person. And that state level, that state special education aid, the allocation won't be enough to cover the 28 and the 30% going forward. So
To be clear, we have no control over that amount.
Correct.
And this isn't anything that we did or didn't do relative to the district budget.
That is correct.
Okay.
Because it's still some certain,
It
right?
is. Yeah, it is. So if other districts around the state see escalating costs in special ed, well, the state's going to have to then dial back what they're able to give us in terms of that prorated amount.
Any questions? Any additional questions? All right, Topher, thank you. Item G, enhancing our future sponsorship.
Yes, we've asked the board to approve the, for our Enhancing Our Future, we have a silver level sponsorship with Aurora Sports Health and Aurora Medical Center Grafton medical staff of $50,000. So they will be recognized on the silver level as well as on the soccer scoreboard for their donation. So we would ask the board to approve this sponsorship.
So moved.
Second.
Any discussion? Hearing none, all those in favor of the motion, aye? Aye. Opposed, and it passes. Thank you. Item H, enhancing our future donations.
Yes, with last Friday being the last day to make donations and have it go on our donor wall for this fall, we had a number of donations that came through, so we have a number of donations that have been added to our report. So we will have a, again in the spring, the fundraising, the donation amounts that are brought forward will be, then in the spring we'll do a reorder of the vinyl that goes on the donor panels. Those will be installed, I believe it's next week is when that's coming. It's been back ordered because of COVID delays and so forth. So we'd ask the board to approve these donation reports for Mike and Marlene Donahue at the donation level of Blackhawk for $1,000, Stephen and Karen Jansen for $1,000, David and Lynette Kelly at $2,500, Kevin and Linda Kurth at $1,000, Jason and Laura Tietz at $1,000, Brad and Ashley Bolich at the varsity level at $5,026, Mark and Nancy Kaler at the varsity level for $5,000, Paula Ann Lorgy at the varsity level for $5,000, Jeff and Joe Mail, varsity level for $5,000, Steve and Shelby Nada at the varsity level for $5,000, Jeff and Ginger Nelson, varsity level of $5,000, Gary and Barb Vanderstill at the varsity level for $5,000, Tom and Lori Robillard, the varsity level for $5,000, and Jerry and Tracy Rossi, bronze at the $30,000 donation amount.
Entertain a motion to accept those donations as presented for the Enhancing Our Future campaign.
Second.
Any discussion? All those in favor of the motion, aye. Aye. Opposed, and it passes.
So Jeff, do you know how far, what our total is as far as for that next phase to complete it with the 50,000 and these donations? Ballpark?
I know someone who can find that out for me very quickly.
No problem.
I don't want to give you a wrong number. We will get to that number for you. Yes, this was a good push. This was a good push with the $50,000 from Aurora, and now the donations that came in here, as well as we still have a donor that we're working with as well. So we're hoping for other sponsorship opportunities, but those are still out there. So we'll get you that number.
With Aurora and with the other pieces approved tonight, for phase, you're looking for phase 2?
Correct.
Yes.
Phase 2, so that we would be within 100 and, we'd be within 105,000 for phase 2.
The scoreboard for Aurora, which are they going on the?
Soccer.
Soccer.
Yep, they've chosen the soccer field for that, their logo to be displayed.
And that includes the transfers that we made, additional
Correct.
transfers that we made
Yes.
from the district.
Yep,
Okay.
it's included in that.
And then what's open then for phase 3? Because we had some money earmarked for phase 3, correct? Do you know what that balance is?
I think we have $110,000 in that.
Right, so 110 has been earmarked specifically for phase 3, which puts us within 250,000 for phase 3.
Okay, so 355 left.
Thank you.
And for these, we send thank you letters on behalf of the board for supporting the project and so forth.
Item I, gift report.
Yes, we have one gift to ask for the board to approve. This is from the Grafton Gladiators. This is a restricted gift for the Grafton High School football team. It's a Rogers Athletic 5-man blocking sled in the amount of $2,500 that we would ask the board to approve.
So moved. Second.
Any discussion? Hearing none, all those in favor of the motion, aye. Aye. Opposed, and it passes. I look for a motion for the Board of Education to convene in closed session to consider 1, staff compensation, 2, performance-related data of the superintendent and other administrators, and 3, financial, medical, social, or personal histories of persons which, if discussed in a public, would be likely to have a substantial adverse effect upon the reputation of any person referred to in such histories or data, in order to consider a request to waive liquidated damages. This is in accordance with Wisconsin State Statutes 19.85, Section 1, Sub C and Sub F. Do I have a motion to move into closed?
So moved.
Second. Second. Motion and a second. We'll take a voice vote. Sean,
Yes.
how do you vote?
Yes.
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 And yes.